Thank you very much. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published on the Daily News, Enquirer, and Legal Intelligencer prior to the hearings, and can also be found on phlcouncil.com. I now note that the hour has come, and will the clerk please call the roll to take attendance. Members that are in attendance will please indicate that you are present when your name is called, and also please say a few brief words when responding so that your image will be displayed on screen when you speak. Madam Clerk?
Good afternoon.
Good afternoon.
Councilmember O.
Good afternoon, Chair and colleagues. I'm present.
Good afternoon.
Councilmember Gim.
Good afternoon, Madam Chair. Good afternoon, colleagues. I am present.
Good afternoon.
Councilmember Green.
Good afternoon, Madam Chair. Good afternoon, members of council, and happy Valentine's Day, or Galentine's Day, as I've learned earlier today.
Good afternoon.
Councilmember Thomas.
Good afternoon, Madam Chair. Good afternoon, colleagues. I'm present.
Great.
Councilmember Brooks.
Good afternoon, Madam Chair and colleagues. I'm present.
And Madam Chair, Councilmember
Good afternoon.
Bell.
I am present. Thank you. A quorum of the committee is present, and the hearing is now called to order. And this is the public hearing of the Committee on Public Health and Human Services regarding bill numbers 210902 and 220051, and resolution number 210046. And Madam Clerk, will you please read the titles of the bills?
Bill number 210902, an ordinance amending Title IV of the Philadelphia Code, entitled the Philadelphia Building Construction and Occupancy Code, by amending Subcode A, the Philadelphia Administrative Code, and Subcode PM, the Philadelphia Property Maintenance Code, and other related sections of the Philadelphia Code to add provisions related to the abatement of rats and other vermin in the city of Philadelphia, all under certain terms and conditions. And bill number 220051, an ordinance amending section 9-4116 of the Philadelphia Code, entitled 2021 Public Health Emergency Leave, to establish additional leave time under certain circumstances, modify existing provisions concerning the paid sick leave, and make technical changes, all under certain terms and conditions. And resolution number 210046, resolution calling for a public hearing to examine the City of Philadelphia's compliance with the Pennsylvania Firefighter Cancer Presumption Act.
Thank you. Before we begin to hear testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for that purpose. Before I call on the clerk to call forward the first panel, would any of my colleagues like to make any opening comments on bill number 210902? Okay, seeing none. Okay, Madam Clerk, please call forward the first panel of witnesses.
Sarah Adamo, Dr. Pelake Ravel Nelson, Dawn Case Weather, and Amelia Price.
Okay, good afternoon. Is everyone ready to proceed? Okay, if you could start in the order in which you were called.
Good afternoon, Chairperson Bass and members of the Committee on Public Health and Human Services. My name is Sarah Adamo, and I am the Legislative Affairs Manager for the Department of Licenses and Inspections. Today, I'm here to provide testimony on Bill Number 210902, which, if enacted, will amend Title IV of the Philadelphia Code entitled the Philadelphia Building, Construction, and Occupancy Code by amending Subcode A, the Philadelphia Administrative Code, and Subcode PM, the Philadelphia Property Maintenance Code, and other related sections of the Philadelphia Code to add provisions related to the abatement of rats and other vermin in the city of Philadelphia, all under certain terms and conditions. I am joined today by Dr. Raval Nelson, Director of Environmental Health Services for the Department of Public Health. This bill will require applicants of certain types of building permits to provide verification that they have prepared a rodent control management plan for the detection, inspection, and treatment of rodents at their site. At a minimum, the plan shall include provisions for abatement of the site by a licensed pest control company. This bill will also require vacant lot licensees to perform yearly inspections and rat remediation by a licensed pest control company. The Department of Licenses and Inspections, along with the Department of Public Health, are supportive of this legislation and are prepared, should it become law, to promulgate regulations to implement and enforce these new regulations. Thank you for the opportunity to provide the testimony on behalf of the administration. We are happy to answer questions at this time.
Excellent. Thank you very much. And if we could, we're going to hold all of our questions till the end. If we could have our next panelist testify in the order in which you were called.
Hello, everyone. Dr. Ravel Nelson will not be able to be on this call today. My name is Dawn Kieswetter, and I am from Environmental Health Services Department of Public Health.
Okay. Thank you, Dawn, for being here with us today. Please proceed.
We are in agreement with the statement made by Sarah Adamo, and I don't have anything further to say unless there are questions.
Okay, no questions at this time from the panel. We're going to hold questions until the end. So thank you for joining us. Next testifier. Is there someone else?
I believe I was number 4. It was somebody third that's supposed to go before me.
Okay, if you want to go ahead, Ms. Price.
Okay, let me just. Good afternoon, Councilwoman Bass and Councilman Clark and all your colleagues. I applaud you and I thank you for seeing the need to mandate language into legislation for public safety and for health. On the week of October the 4th, we had a rodent problem with rats. Over 100 rats was in an empty lot. And I'm asking City Council in reference to the absentee property owners who have vacant lots and vacant buildings. And that's where people do a lot of the short dumping, illegal short dumping. And that's what attracting the rodents. I take a stand that it's not a privilege to live rodent-free. It's a right to live free. So I thank you all for putting this into legislation, both bills.
Thank you. Thank you for your testimony. Do we have any questions for this panel from members of council? Any questions at all? Okay, I don't see any. Let me just, we'll just keep going then. Madam Clerk, are there additional panelists to testify on this bill?
There are no additional panelists on this bill, Madam Chair.
Okay. Well, in that case, and since there are no questions, I want to thank everyone for being here today on this very important piece of legislation, particularly as the city of Philadelphia is, as we all know, in the midst of a building boom. I want to say that right, a building boom. We want to make sure that, we're not causing unnecessary problems or unnecessary issues as a result of the building that's coming from this disturbing ground that's been laid dormant for a very long time. So I want to thank you all for being here, for being in support of this public health situation, which is really going to be affecting communities throughout the entire city of Philadelphia. So I thank you so much for being here. And that being said, Madam Clerk, can you call forward the panel on the next bill that we have for today?
Rich Laser, Raina Guzman Cesar, Sarceres, Carly Pourzan, Melissa Walter, Jennifer Zavala, Ayana Boca, Nazareth.
Let's start with just the first three. So why don't we start with the first three? And if we could have those folks come, and just to be clear, we're now calling panelists and witnesses on bill number 220051. Is that correct, Madam Clerk?
Yes, that's correct, Madam Chair.
Madam
right.
Chair, can I be recognized before the panel starts, please?
Absolutely. Okay. So, all right. So why don't we go ahead and start with the sponsor of the bill, Councilwoman Kendra Brooks, who are now recognized.
Thank you so much, Councilmember Bass. I would like to make a few comments before we hear from our panelists about the COVID-19 paid sick leave bill. Council passed public health emergency leave twice over the pandemic to protect our city's workers during the global pandemic, but that leave ended last year. And as we all know, the pandemic has not ended, and our workers are still in need of protection. For the last 2 months, workers have been left out of mandatory paid sick leave protections. My office has heard firsthand that this has made a recent spike in cases high due to the highly contagious Omicron variant, especially on workers, especially low-wage workers. These workers are disproportionately immigrants, Black and brown people, and women. The communities have been most impacted throughout the pandemic, and many of them are once again being asked to choose between coming to work sick or missing a paycheck that they can't afford to miss. As the cases decline and vaccines become more widely available, there is much to be hopeful about. But with schools, stadiums, and restaurants open, we must continue to be vigilant. A successful reopening is one where workers know that then they can come to work again, and they'll be safe, and they'll be able to keep their families safe. And is one where members of the public feel confident interacting with employees, and protecting workers is not just the right thing to do, and it's good public health policy, and also good business strategy. The previous 2 emergency sick leave bills were signed into law, protected thousands of workers, and kept businesses open safely. And in fact, many businesses are already doing the right thing and providing adequate paid sick leave to their workers during the pandemic, showing that protecting workers also protects businesses. I would like to thank my co-sponsors on this bill for their support, Council Members Bass, Gautier, Gilmore Richardson, Gim, Parker, and Thomas. Thank you so much.
Thank you, Madam Chair.
Oh, wait, I have one other thing I want to add about the amendments. I forgot about that. We have a few amendments that we created after feedback from stakeholders. The first amendment was that we changed the sunset provision so that the bill expires December 31st, 2023, rather than 365 days after its effective date. Okay. And we made this decision after feedback that the end of the year is more workable for employers than a mid-year end date. Mm-hmm. We made adjustments so that businesses with generous paid leave benefits are not required to provide additional leave under this bill. And we clarified provisions around certain labor negotiations and collective bargaining agreements. And we also included heightened enforcement language that authorizes periodic publishing of employers with current unresolved violations as permitted by law. So we know that the time to pass this bill is now. We cannot have another surge and another outbreak where workers are being forced to come into work with COVID, and passing it around to their peers and at work and bringing it home to their families. So workers who go in every day during the pandemic to provide services to the public that deserve to be able to voice their concerns and stay home knowing that they can still pay their bills. Thank you so much, Madam Chair.
Thank you, Madam Chair. Thank you, Councilwoman. And I know we're going to get into it a little bit further along, but I did have a couple of questions, but I'd like to probably hear directly from the panelists and those testifying, because it actually may address some of the questions that I have ahead of time. So thank you very much. If we could now have the first witness testify.
Good afternoon, Chair Bass and members of the committee. My name is Richard Laser. I'm Deputy Mayor for Labor, and I appear before you today to testify on Bill number 220051. This bill is a further extension of the Public Health Emergency Leave Ordinance that was passed in June 2020 in response to the COVID-19 pandemic. While the original bill sunset at the end of 2020, the pandemic is still impacting the lives of Philadelphians in countless ways. This is the second renewal of the Public Health Emergency Leave Ordinance, and if passed, will extend and in some cases expand upon these emergency protections. I'd like to highlight the inclusion of the bad actor language in the ordinance. The pandemic has been the main cause in sick leave complaints increasingly being filed with the Department of Labor, tripling in numbers since pre-pandemic. Most of this increase was from essential workers employed in food service, supermarkets, department stores, and healthcare. These workers have been the backbone of our neighborhoods and community. And in authorizing the department to publish a bad actor list, the bill gives us another tool that can be used to ensure equity and justice for hardworking Philadelphians. I would also like to note that the different iterations of this emergency benefit have applied to different sized businesses during the pandemic. While the first iteration applied to all employees, the second iteration applied to only businesses with 50 or more employees. This current iteration, as proposed, would mirror our existing paid sick leave ordinance and apply businesses with 10 or more employees. This enlarged scope could prove burdensome for some employers, and if unchanged, the Department of Labor will work closely with the Department of Commerce to ensure proper education and enforcement of the new ordinance go hand in hand. I'd like to thank Councilperson Brooks, the sponsor of this bill, and all the co-sponsors for their leadership on this issue. And we will enter our third year of the pandemic. This bill will ensure critical workplace protections stay in place for employees in the city of Philadelphia as we continue our recovery from COVID-19 over the next year. At this time, I'm happy to take any questions from the panel or from the committee.
Thank you, Mr. Laser. We're going to hold the questions to the end. Thank you. Next panelist. Madam Clerk, can you call the next panelist who was after Mr. Laser?
Raina Guzman, Sorceress.
Raina, are you here? Oh, here she is. Okay.
I'm here.
All right, great. Please state your name for the record and begin your testimony.
Okay. My name is Reina Guzman Cázares. I'm speaking Spanish. Okay.
Okay. Do you have, is someone available to do interpretation services, or do we have someone on the call who can?
I'll be reading the same letter in English after Reina.
Okay, excellent. Thank you.
Yeah.
Okay, thank you. Hola, mi nombre es Reina Guzmán Cázares y soy miembro del Comité de Trabajadores. Voy a leer nuestra carta a continuación. Querido Consejo Municipal y alcalde Kenny, somos el Comité de Trabajadores. Somos un grupo de trabajadores inmigrantes que queremos una industria de restaurantes más sana y segura para todos nosotros. Somos una ciudad maravillosa y multicultural, con miles de restaurantes diversos. Pero cuando nos vemos obligados a trabajar, cuando estamos enfermos, toda la industria y la ciudad sufren. Si queremos reducir la propagación de COVID-19 y mantener a los habitantes de Filadelfia saludables y prósperos, necesitamos licencias por enfermedad pagadas. Les escribimos para exigirles que aprueben el proyecto de la ley de la concejal Kendra Brooks para la licencia por enfermedad pagada de emergencia. Necesitamos esto para todas las empresas pequeñas y grandes, porque todos los trabajadores deberían tener acceso a licencia por enfermedad pagada. Por ahora, les pedimos que aprueben este proyecto de ley para trabajadores en empresas con 10 o más empleados. Estamos escribiendo en lugar de hablar para proteger nuestra propia seguridad, pero creemos firmemente que nuestro mensaje debe ser escuchado. Aquí hay algunas citas de nuestra base de datos que explican por qué necesitamos licencia por enfermedad pagada de emergencia. Un trabajador dijo, para mí es importante que me aprueben esto porque tengo hijos y si me enfermo o ellos se enferman, yo podré quedarme en casa con ellos. Esta ley también me muestra que soy valorado como persona, porque cuando estoy enfermo puedo quedarme en casa y curarme. Esto me hará sentir visto como un ser humano. Otro trabajador declaró, si me preguntan, la licencia por enfermedad pagada de emergencia es importante no solo para mí, sino para todos. Me ayudará y protegerá a las personas que me rodean. De lo contrario, en una historia interminable, el ciclo del COVID simplemente continuará. Nos obligan a trabajar mientras estamos enfermos. Y si tenemos COVID, vamos a ir a trabajar de todos modos por nuestro miedo a perder nuestro trabajo. Hemos tenido este abuso en el pasado y no quiero que me despidan injustamente. Esta ley me hará sentir protegido y seguro. Otro trabajador más nos dijo, últimamente he tenido mucha mala suerte. Mi esposo se enfermó de COVID-19 en diciembre y luego yo también me contagié. No fui a trabajar durante una semana para poder mejorar y no contagiar a otros. Le dije a mi jefe que estaba enfermo y que necesitaba faltar al trabajo por ese motivo. Sin embargo, cuando volví a trabajar la semana siguiente, mi jefe me dijo que ya no trabajaba ahí. Ya había contratado a alguien más. Entonces, no pude encontrar otro trabajo. Necesitamos despegar cuando tengamos COVID y luego volver a trabajar saludables. Un trabajador no está seguro acerca de la vacuna, pero dice, aunque tenía mis preocupaciones al respecto, me vacuné y luego no querían pagarme mi vía libre. A otro le dicen que trabaje cuando esté enfermo. Mi empleador no me ofrece ningún día por enfermedad y me dice que tengo que ir a trabajar cuando estoy enfermo. Me dijo que no me pagará por estar en casa sin hacer nada. Es por eso que yo apoyo este proyecto de ley y quiero esto de días de enfermedad pagados por emergencia. Un trabajador más nos compartió. Mi restaurante cerró por COVID durante una semana. Mi trabajo ofrece licencia por enfermedad pagada debido a la ley, pero solo teníamos unas pocas horas con la ley existente. Realmente podríamos haber usado 40 horas más para COVID-19. Hay muchos más trabajadores con muchas historias como esta. Aprobar hoy el proyecto de ley de la concejal Kendra Brooks para la licencia por enfermedad pagada de emergencia. Por favor, escuchen nuestro trabajo, aprécienos como seres humanos. Atentamente, el Comité de Trabajadores.
Okay, should I go? Okay.
Please proceed.
Hi, my name is Carly Porzant. I'm an organizer with 2 and 5 People's Alliance and a supporter of El Comité de Trabajadores. I am going to read this letter in support of Bill 220051 from El Comité in English. This letter has the full support of 2 and 5 People's Alliance and the Coalition for Restaurant Safety and Health. Dear City Council and Mayor Kenny, we are El Comité de Trabajadores. We are a group of immigrant workers who want a healthier and safer restaurant industry for all. We live in a wonderful and multicultural city with thousands of diverse restaurants. But when we are forced to work, when we are sick, the entire industry and city suffers. If we want to reduce the spread of COVID-19 and keep Philadelphians healthy and thriving, we need paid sick leave. We are writing to you to demand that you pass Councilmember Kendra Brooks' bill for emergency paid sick leave. We need this for all businesses, small and large, because all workers should have access to paid sick leave. But for now, we're asking that you pass this bill for workers at businesses with 10 or more employees. We are writing instead of speaking to protect our own safety, but feel strongly that our message should be heard. Here are a few quotes from our base that explain why we need emergency paid sick leave. One worker said, "For me, it's very important to have this approved because I have children, and if I get sick or they get sick, I will be able to stay home with them. This law also shows me that I am valued as a person because when I am sick, I can stay home and get better. This will make me feel seen as a human being." Another worker said, "If you ask me, emergency paid sick leave is important not just for me, but for everyone. It will help me and protect the people around me. Otherwise, it's a never-ending story. The cycle of COVID will just continue. Our bosses force us to work while we are sick, and if we have COVID, we're going to work anyway because our fear of losing our job. I have had this abuse in the past, and I don't want to be fired again unjustly. This law will make me feel protected and safe." Another worker shared their story saying, "I've been having a lot of bad luck lately. My husband got sick with COVID-19 in December, and then I also was infected. I did not go to work for a week so that I could get better and not affect others. I told my boss that I was sick and needed to miss work for this reason. However, when I went back to work the next week, my boss said I didn't work there anymore because I was gone for that week. He already hired someone else. Then I couldn't find another job. We need to be able to take off when we have COVID and return to work healthy." One worker was unsure about the vaccine, but then said, "Although I had my concerns about it, I got my vaccine. Then they didn't want to pay for my day off." Another worker is being told to work when sick, saying, "My employer is not offering me any sick days and tells me that I have to go to work when I'm sick. He told me he won't pay me to be at home doing nothing. That's why I support this bill and want these emergency paid sick days to support that I should be able to take off." Another worker shares, "My restaurant closed for a week because of COVID. My job offers paid sick leave but because of the law, but we only have a few hours with the existing law. We could have really used 40 more hours for COVID-19. There are many more workers with many more stories. We now need to learn to live with COVID-19, and that includes being able to take time off when we're sick to prevent the spread. Please pass Councilmember Kendra Brooks' bill for emergency paid sick leave today. Sincerely, El Comité de Trabajadores." Thank you.
And thank you. And I believe, do we have one other panelist, Madam Clerk?
Yes, we have a few more panelists, Madam Chair.
Why don't we do one more so that we can have three, and then we'll open it up for the questions from the panel.
You want 3 panelists? We have
three
5.
in total. So we had Rich, we had Ms. Guzman.
We have a total of 5 more panelists, Madam Chair.
Okay, let's have one more testify.
Melissa Walter.
Okay.
Hello, everyone.
Hello, if you could state your name for the record and proceed with your testimony.
Yes, my name is Melissa Walter. I am the co-founder of Love City Brewing Company. We're a craft brewery and tap room that opened in 2018. We're located in the 1st Councilmanic District. And I want to thank Councilperson Brooks for introducing this bill and Councilman Scola for co-sponsoring it as well. So we currently employ 20 people, 8 of which are full-time and 12 are part-time. So these regulations absolutely would apply to my company. But our internal policies actually go above and beyond what's required by this bill. But I'm supporting this bill because I believe it's beneficial for the city and manageable for small businesses. In general, sick leave is incredibly important for service sector employees. Nobody wants someone who's ill handling their food and beverages, and coworkers don't want to risk getting ill themselves from their coworkers. But the simple truth is that workers who can't afford to stay home won't. You know, if the decision is between coming to work with an illness and missing out on a portion of your income, many people will choose to work, especially if that income is the difference between being able to pay your bills. So I believe this bill is good public health policy, but I also believe that it's a good business decision. So a quick example, obviously one of our bartenders unfortunately came down with COVID-19. She was scheduled to work on a Saturday and was experiencing symptoms. So we asked her to take a COVID test before coming to work, which we actually provided. And it came up positive. So she stayed home for 5 days, her symptoms resolved, and she came back to work later that week. So in the end, our company paid $15 for the COVID test and about $360 in sick leave benefits. This bartender supports her family, and I don't know what decision she would have made if she didn't receive sick pay, but I can guess what would have happened to our business if she came to work and infected other people. Nearly all of our workers are on shift on Saturday, and even if 50% of them became ill, we would have likely had to close our doors due to the inability to staff the tap room. So paying under $400 in benefits likely saved us thousands of dollars in possible lost revenue. In addition, many servers who left their positions during the past 18 months cite the lack of sick benefits as one of the reasons. And I believe our company is a testament to how providing those benefits can actually minimize turnover. So from March 2020 to March 2021, we retained over 80% of our staff. And hiring and training new employees is always costly. We all know that. So any policy that helps employee retention, I believe, is good for our bottom line. So as a city resident and a business owner, I fully support this bill because it helps workers stay healthy and follow the CDC guidelines. And I believe it's the right thing for public health and for small business. Thank you.
Thank you. Thank you for your testimony. Very informative and good perspective. Can we we will now open it up for questions from members of council. I'm going to start with Councilwoman Brooks and then Councilman Green. Councilmember Brooks.
Thank you so much, Madam Chair. My first question is for Deputy Commissioner Richie Laser. Has the department recorded any complaints of fraud or abuse related to this benefit? Is he still on? Did we lose him?
It looks like he's still here. Mr. Laser? Oh, maybe he's having some difficulty coming off of mute. Oh, there he is.
Okay, there he is.
I'm having difficulty here. Can everybody hear me?
Yes, we can hear you.
All right, I'm having a hard time with my mute button. Yeah, I mean, we've gotten, like I said, we've gotten increasing complaints. I know Candace Churning from my office is on here to speak to specifics on any of the specifics you asked, but I know we've gotten a lot of complaints, especially come in since it was in effect. Candace wants to jump.
Was it specifically about fraud or abuse?
Not to my knowledge, but I will defer to Candace because she oversees the enforcement.
Hi, this is Candace Tuning. We have not received any, we don't track fraud, paid sick leave fraud or abuse from employees, if that's the question. We only receive violations from employees against employers on not providing paid sick leave.
Thank you so much for that. My next is a thank you. I want to thank Raina for sharing her concerns of other immigrant workers, and for the stories like yours. That's exactly why we're trying to produce this bill, because we're trying to prevent. So I want to thank you so much for sharing. And can the interpreter share that with Raina as well, please?
Gracias, Reina. Te quería agradecer por compartir las historias de los trabajadores y lo que nos has contado el día de hoy.
Gracias por la oportunidad que nos ofrece. No solo soy yo solo vengo representando a un grupo de trabajadores inmigrantes que lo único que queremos es que se nos reconozca nuestro trabajo y que nuestra salud es importante. Somos familias trabajadoras, amamos a Filadelfia, estamos agradecidas con Estados Unidos, pero también necesitamos y merecemos la protección. Gracias por el espacio.
Thank you for the space, and thank you for listening not just to me, but as a representative of a whole community of workers who needs to be represented and heard and protected during such a difficult time. And we love the United States, but we feel that we also need a voice and be protected here.
Thank you. And my last question is for Melissa. What do you say to those who might call this bill bad for small businesses like yours?
I mean, I understand that we are all still probably in a financial situation, coming out of COVID-19, but I don't believe that not offering sick benefits is going to improve our financial situation at all. If workers feel protected and feel like they can stay home when they're ill, then they likely will, and will prevent the spread of COVID-19, and I think we'll come out better with better bottom lines as well.
Thank you. And my last question is for Melissa. What do you say to those who might call this bill bad for small businesses like yours?
I
Thank you so much, Melissa. Madam Chair, that concludes my questions.
Thank you very much, Councilwoman. And now we'll move to Councilman Derek Green.
Thank you, Madam Chair. I want to
You're
thank the sponsor for this legislation. It's important to keep workers safe in our city, as well as making sure that we have a vibrant community of businesses of all sizes in the city of Philadelphia. I was struck, though, by the testimony by Mr. Laser. In your testimony, you used the phrase "some burden," and I wanted to get some perspective by what you meant by that. Was that in reference to certain types of businesses? You said there was. I want to make sure I have the full context of your question, and I think you used the phrase "some burden." I just want to get some more perspective on that.
Yeah, the Department of Commerce had some concerns about this bill being enforced on businesses with less than 50 employees.
And can you give some more context when you said some concerns?
I believe there might be somebody from Commerce on here to answer a question, but I believe there was more on the financial burden that it would put on a small business under 50 employees.
I see Nazra Sabri is here from Commerce. Nazra, do you want to respond to that question?
Good morning, Councilwoman Bass and all the
Good
council.
morning. Good afternoon.
This committee. We did initially have some concerns, but once we found out or learned that this bill mirrors the paid sick leave that is already on the books, we vacated that. But as Rich Laser stated, initially we did have some concerns around, operating costs and lack of talent and the financial burden that it would bring on small businesses. But again, we are not there anymore. So we are just committed to committed to talking to you all about the benefits of this bill and how we can move it forward.
Very good.
And I was just curious, trying to get some context, because the paid sick leave bill was passed at a different time when the city and actually the world was in a much different financial state. I know from testimony that Commerce has provided and other entities that a number of businesses were significantly impacted by the pandemic, especially Black and brown businesses on our commercial corridors. Many of those businesses that are already struggling, many due to lack of resources and lack of support, actually had to close. A disproportionate amount of African American and brown-owned businesses had closed based on information from both the United States Census and the Wall Street Journal coming out of the pandemic, as opposed to majority-owned businesses that have traditionally had higher capitalization. So my understanding from you, Ms. Sabri, is that the Commerce Department no longer has those concerns in reference to small businesses, especially on our commercial corridors.
We are further discussing what our concerns are. So we have noticed that there have been initially with the first paid sick leave pre-pandemic, we had some concerns, and we do understand there are a lot of issues that our small businesses are experiencing. However, we want to, I'm sorry, I'm going in and out. But we want to just make sure that, what is on the books is representing all businesses and it's not further affecting what they're going through pre-pandemic as well as during the pandemic. So we're discussing, we are in discussions about some of the other benefits that could come of this bill.
Okay. If I could have Mr. Laser come back.
Yep, I'm here, Council.
Okay. So if I remember correctly, and I apologize, I just got back in town from a funeral. This bill is an amendment to the original public health emergency leave, or is this the third iteration of that?
This would be.
Right. I think Mr. Laser has connection.
Mr. Laser, can you repeat that? You blocked out on us. You went out on us. Can't hear you.
No, we're still not here.
I can jump in since his audio is not working. It's the third.
Okay, who was that speaking?
This is Candace Tuning from the Office of Worker
You just have to state the name for the record for the stenographer.
This is Candace Tuning from the Office of Worker Protections.
And you said this is third.
Yes, it's the third.
Okay, and so in the first and second iteration of this bill, this applied to employers of how many employees?
I believe this is Nazara Sabri. I believe it was 50 plus.
So
the
first one of the iterations was 50. Can you hear me? I can't tell if I'm coming.
You have to state your name again for the
Sorry, this is Candace Tuning. One of the PHELs was 50 or more employees. And the other one was everyone who was not included within the FFCRA.
Okay, so that means, so for the second iteration, was that also 50 employees?
Yes, the second one was 50.
Okay, so I just want to make sure I understand the record, because like I said, I'm trying to catch up, because I've been out of town. So all of the public health emergency leave bills have been based at a 50 employee threshold.
No, the initial PHEL was for all employees who were not covered under the FFCRA. The FFCRA covered employers with 499 or less employees with a separate requirement. And so this would have been 500 or more was the initial public health emergency leave.
Right. Okay.
The second one, and it is a bit confusing, I know, but the second one was 50 or more employees.
Okay, so 500 was the first one. The second bill was 50, and now this is, as proposed, is at 10.
This is at 10, yes, and that is, as Rich had said, that echoes the original 2015 bill.
Right, but the 2015 bill was not during the pandemic like the other two pieces of legislation were.
That's right, yeah.
All right, just want to make sure I have an understanding. Okay. Thank you, Madam Chair.
Thank you, Councilman. Do we have any other questions from the panel? Any other questions for members of council? And if not, we'll have the clerk please read the next panelists for this bill.
Jennifer Zavala, Ayana Boca, Nazara Sabri, and Will Carter, Esquire.
Okay, and if we could have folks proceed in that order. Jennifer, are you here?
Yes, I'm here.
Okay, Jennifer, if you could state your name for the record and proceed with your testimony.
Yes, my name is Zavala. I am chef co-owner of Wana Tamale at 1941 East Passyunk Avenue. I'm trying to figure out my camera here, so please allow me a minute to turn that on. Let's see. I think it's not working, so I'm just going to go ahead and speak to the panel.
All right.
Thank you for support this bill and Brooks moving forward. And this is what I have to say as far as my experience in the restaurant industry and especially dealing with COVID over the last couple of years. So I am 27 years into the food service business. I have been here in the city of Philadelphia the last 15 years of my career. I live in South Philadelphia. Some of you may know me from various things around the city. I have been on Top Chef Season 6. I am part of La Dame Escoffier, which is a national women's organization in food service. I am also an ambassador for CORE, which is Children of Restaurant Employees, which we support and provide financial aid to the children of restaurant employees throughout the country. In my 27 years of working in food service, I can say there has been one time that I've been ever offered benefits or even considered taking time off when I've been sick. And here I am as an employer in the city of Philadelphia. Opening my business is fairly new, been open for 3.5 months, and to say it has been challenging is an understatement. COVID has wreaked havoc on every aspect of life for everyone. One of the things that has affected me the most, especially with opening a business, is I have children. And I'm a two-person working household as well as opening a new business. It has been extremely difficult to manage that and to know that there are employees who live the same life as me, which is to have children, and having a day off or taking a day off because you're sick can wreak havoc on your everyday life, as well as it being a public health issue. Having an employee come to work sick means that I put my child potentially at risk for getting sick. My child has medical issues, had heart concerns since he's been born, and knowing that I would be passing that on to him just to have an employee come in so I can provide food and a bottom line, it just didn't seem morally correct for me. Recently, Philadelphia Magazine has dropped the 75 most influential people, and I have ranked number 45. And the reason for that is after my 27 years of experience, and over the last 2 years, I can open a restaurant and I can provide food, but for me, what has been most important is to be a game changer in food service, and that is respecting people that I work for me. When someone comes to me and says that they came in because they are sick, it is my responsibility to accommodate that by allowing them to have the time off, paying them, because if they don't come to work, then that can wreak havoc on their everyday life. I'm a micro business, so I only have 7 employees. I believe it was 10 and now it's up to 50. Even still, I provide a living wage, I provide resources for insurance, and we also provide catastrophic insurance just in case one of our employees who's not actually working that day or, with COVID or whatever have you, has to go to the hospital, we cover that. Knowing that I respect the people that work with me has been more productive for my business. The other time I've been a boss or had to employ people. I feel this bill is really important because you can't put a price on the human experience. I don't think there has been one person that hasn't been affected by this greatly. Parents, single parents, grandparents, whether you've had COVID or you've indirectly had someone in your life that has had COVID. I have 7 employees. In one day in January, we had one of our employees' aunts pass from COVID. We had another one of our employees whose father got rushed to the hospital of complications with COVID, and they found out he had colon cancer. We had another employee who, due to the rent issue, was couldn't pay rent, was having to deal with some moving issues all of a sudden. I shut my business down for a week to allow everyone to regroup. The responsibility of being open and trying to make people come into work or putting pressure on them that I'm not able to meet my bottom line was just not something that I'm willing to go to bed with that night. There also are parents that work in my business, and childcare has been extremely difficult. I know that firsthand, so I've experienced it myself. But to also see employees have to deal with that issue as well has been something that is far from concerning. I think it's kind of this major public health issue, allowing people who are handling your food who are not well, if you are getting the COVID vaccine, that also you need a time to heal your body if you're dealing with some sort of previous health issue or just it affected you differently than someone else. And it's important to allow people, since you're asking them to do that for you, the grace to be able to take care of themselves if they're not feeling well from that shot. This is very important to me as a small business because I believe it's time for us as business people to be better business operators and respect the people that come in every day and work for you. It allows you to make money, to live the life, and to have the dream that you wish for yourself, the autonomy, and time for your family. if we are falling so going down, what does it say about
Jennifer? 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 Hello? Jennifer? Hello, Jennifer, can you hear us? I think we may have lost her. Jennifer? Oh, no, she's there. I see her. Okay. We'll come back to Jennifer if you can hear me. We really couldn't hear you, especially towards the end. It was going in and out, and then in the end it was mostly out. So we'll come back if you want to summarize your remarks. In a few minutes, we'll swing back before we end this panel. The next speaker, I believe, was Nazara, but I know, Nazara, you already spoke. Did you have additional comments or testimony that you wanted to give on behalf of Commerce?
No, just that I'm available for questions.
Very good. Thank you so much. And I believe next we have Mr. Will Carter from the Philadelphia Chamber of Commerce.
Yes, Councilwoman, can you hear me?
We can hear you well.
All right. Thank you, committee, for allowing me to testify at this time. The business community certainly has a stake in ensuring public safety and is working with the government to have our city return to as normal a state as can be expected. However, across the city, the impact of COVID-19 virus is evident with too many vacant storefronts, and the viability of many of our commercial corridors has been sapped. For those reasons alone, proposals that would increase costs on already struggling businesses should be approached with the utmost sensitivity and consideration of each's very real circumstances. I can say, many of you all know I worked in City Council 16 years prior to joining the Chamber as Vice President. I actually co-wrote the legislation regarding sick leave back in 2011. And I think the point was made earlier by Councilman Green that was during a time when there was no pandemic or no economic emergency in addition to a health emergency happening. It actually took us 1.5 years to get that written and passed. This bill was introduced 3 weeks ago and it's been on the fast track, or at least in my opinion, put on the fast track to being passed today out of committee. And I don't think the appropriate amount of consideration has been given in talks with businesses and those affected by this legislation has been had. So the due diligence that I know it requires on a bill that affects this many businesses throughout our city that are struggling has, in my opinion, not taken place. We did have a conversation with the councilwoman on Friday. It was about a 15-minute call. They said they, would consider our amendments. We had amendments that were introduced. Those amendments, when I woke up this morning, were not included in the amendments that the councilwoman has proffered during this meeting. And so it's just, it's really frustrating when you represent working people, and business people are just as much working people as individuals are. Matter of fact, business owners are working 365 days a year, 24/7. They're working so hard that they're creating work for other people. They are no less working people than individual workers out here. And I think it's, a lot of the business community feels as though the city council and some members of city council don't respect that or don't appreciate the work that they're putting in to try to even survive out here. I hear it on a regular basis. In the very least, when you're about to double the cost on their businesses in this particular way, it shouldn't be a rush process. You should sit down a couple of stakeholder meetings, not phone calls where there's just Zoom with people like myself that you guys are used to hearing from, but real business owners who say, I'm about to leave the city of Philadelphia because I can't take it anymore. And we need those jobs here. The bottom line is we need those jobs here. And if you look at every indice that I've seen from very reputable sources, the Pew Charitable Trust, think tank, we rank as a city at the bottom in terms of business-friendly environment. for some reason, it seems as though we don't treat our businesses with a sense of kinship. Like they're our businesses. I go to other cities, they promote their businesses. Hey, Atlanta, we got Coca-Cola, we love them. Why? Hey, they're providing jobs and economic development and activity. Hey, you go to Nashville. Nashville is booming right now. My mother used to live there. They embrace their businesses and want them to stay there because that's where the jobs are coming from. So when you have a city that's known, unfortunately, with the largest poor population, you have to really look at your private sector and say, I need to support you guys because that's where the jobs are going to come from. So we can get people out of poverty, train people for the jobs of the day, and increase our standing economically. It's just unfortunate that I think all I can say is this: we can do more to embrace our business community. And I wish they had time to get on these calls, but they're working 24/7, 365. So we appreciate if you all will consider the amendments, particularly the one that would raise it back up to 50. As was indicated earlier, the past legislation was passed during an emergency. It's my understanding that the government has dropped the emergency declaration now. So this is just simply adding sick time on. It's not even an emergency. It's in the title, but it's not an emergency. It's an understandable. Hey, we don't want anybody going to work sick. Nobody wants that to happen. But on the federal level, when they passed it, they had tax credits to help businesses to be able to afford it. This is not offered at all in this legislation. There's nothing that says, hey, we're going to figure out how to help these businesses do this. It's just assumed that they have the money. And my mother told me a long time ago, don't count money in other people's pocketbooks. And I think that's what's happening in this particular case right now. The young lady who spoke earlier, who owns a business, was very anecdotal. I think everybody should be able to do this. She's counting money in other people's pocketbooks. You don't know what's going on with each individual business until you sit down and talk to them, and they explain to you with exasperation on their face how they're struggling to stay afloat. So with that testimony, we would really appreciate more time to talk with the council member about this. I think that you will see by and large, when you speak to real people, and we're talking about black, white, Asian, what have you, across the board, they are struggling to stay afloat and keep anybody on the job, let alone even having to add more time on. So people understand, the business community understands that we need, we don't want people working sick, but at the same time, there should be more consideration given to how something like this can come together over a little bit more time to talk about it and understand, the people you're affected. And see, to me, if you're going to pass a bill from the beginning, those are the people you should be talking to right off the bat before you introduce it. But, that's sometimes that just doesn't happen. And that's my testimony. Thank you, Councilwoman.
Okay. Thank you, Mr. Carter, for your testimony. And we will have some conversations, as members of council around making sure that there's due process and that we, hear your voice and your concerns. We don't want anyone to feel that they don't have a voice in the conversation. Okay. Madam Clerk, additional panelists?
Yes, Madam Chair. Zach Isaac, Amber Smith, and Walter Thomas.
Okay. And Zach, if you could please state your name for the record and proceed.
Good afternoon, Chair Bass. My name is Zach Pyzik, and I am the Director of Government Affairs at the Pennsylvania Restaurant and Lodging Association, the PRLA. And again, good afternoon, Chair Bass and members of the Committee on Public Health and Human Services. We appreciate this opportunity to submit feedback regarding Bill number 220051. PRLA represents restaurants, hotels, and the entirety of the travel tourism industries in Pennsylvania. There are more than 26,000 restaurants, 1,500 hotels, and 100 travel and tourism partners that we do represent. More than 350 PRLA members operate in Philadelphia, and about 75% of those restaurants are considered smaller operations, with nearly 25% that are minority or women-owned businesses. The last 20 months have been extremely challenging for operators in the tourism and hospitality industries. The only thing that's been predictable for so many small businesses in Pennsylvania is unpredictability. The data shows concerning trends. Sales are down 30% compared to the same time of year in 2019. 93% of restaurant operators report staffing shortages, and 65% report higher food costs now than before the pandemic. Our national partner just released Pennsylvania-specific results from its latest COVID-19 restaurant impact survey. And as you can imagine, the Omicron variant has negatively impacted business conditions in Pennsylvania. For example, 93% of restaurants have experienced a decline in customer demand for indoor dining. 56% of operators have reduced hours of operation, and 59% have closed on days they would normally be open. It's clear that Philadelphia businesses have been hit much harder than other regions of the state, primarily due to winter and lack of outdoor dining, the increase in COVID-19 cases that we saw at the start of the year, and additional mitigation. 84% of operators say business conditions for their restaurants are worse now than they were just 3 months ago. PRLA and some other stakeholders from the business community met with Councilmember Brooks last week. We spent an hour with the council member and her team discussing many of the concerns I mentioned earlier. PRLA Philly Chapter President Kamara Edwards from Jet Wine Bar shared at that meeting details on steps operators from all over the city have taken to assure that staff and guests are safe and to create processes that provide for time and flexibility for employees that may need to deal with personal or family health concerns. Together with the city, our members, and many on this council, PRLA and operators from all over the city helped facilitate vaccine clinics for employees in the hospitality industry, and just recently we distributed thousands of free at-home COVID tests. Safety is and always has been front of mind for the industry. We are appreciative of Councilmember Brooks listening to our concerns and our opinions regarding this bill and on what we see as a reasonable path forward. Nevertheless, since that meeting, some of the smallest businesses that we represent are still concerned that they have an insurmountable path forward. We understand the significance of good workplace culture and flexibility for employees, and that's why many of our members choose to go above and beyond at great costs of their own, and many have told us that they already provide employees with generous time off. Even when closed due to the pandemic, restaurants were still paying their employees since those employees are like family. PRLA and City Council has always had a good working relationship. We appreciate many of you that have stood up for the industry during these tough times, like Councilmember Parker with third-party legislation that was recently passed, and Councilmember Dom on outdoor dining, and many others as well. In fact, PRLA has engaged on this subject before in the past as well. This legislation, however, goes a lot further than similar legislation that we've seen on the subject in the past. This version of the COVID-19 sick leave bill lumps large and small businesses into the same category. The initial intent of this legislation was to provide flexibility to employees as we all navigate the pandemic, which is why prior versions of the bills had sunset dates that were connected to the pandemic in some form or another, specifically to Governor Wolf's emergency declaration. This legislation was always and should continue to be linked to the COVID-19 health emergency. However, the most recent version is now set to expire at the end of 2023. We believe strongly that the bill should be tied into the pandemic like originally intended instead of a date set at the end of next year. Previous forms of this legislation also had significantly higher employee thresholds when defining covered employers. Under the newly written legislation, this time around, small businesses with just 11 or 12 employees are expected to meet many of the same administrative and financial obligations as larger corporations with thousands of employees. There are thousands of businesses in Philadelphia with just 10 to 49 employees that would be impacted by this legislation that many do not even know we're discussing today. We've heard from dozens of owners and operators from all over the state recently that have struggled so immensely at hiring and retaining staff that they've been forced to shut down operations after only one employee tests positive for COVID-19. Of course, restaurants have and will continue to do all that they can to accommodate their employees and will always prioritize keeping their staff and their guests safe. This mandate goes beyond that, though, as it puts an additional burden on restaurants and other smaller operators in the city at a time when they are already being pressed and squeezed in every way imaginable. Lastly, we feel this legislation misses the mark on some other goals related to the pandemic, specifically as it relates to the vaccines. The city has emphasized the importance of increasing vaccinations, which PRLA has supported. As noted earlier, we've worked hard to help with vaccine efforts in Philadelphia. That's why we were disappointed that the legislation didn't do anything to encourage vaccines or to address distinctions between those employees that have gotten vaccinated and those out there that have not. We have discussed our concerns both privately with council and publicly. We're thankful to be part of this conversation with this committee today, and we hope that the committee will consider these concerns as the bill moves forward throughout the legislative process. PRLA looks forward to continue dialogue on the subject, and we stand ready to assist in any way we can. Thank you, Chair Bass, and the rest of the committee for allowing me the opportunity to speak with you today.
Thank you very much for your testimony, and I see that we have a question from Councilmember O.
Thank you very much, Chairperson. My question is to PRLA. In particular, who did you reach out to have a conversation about this with on council?
PRLA recently met with Councilmember Brooks about the bill. We've also had conversations, I believe, with Councilmember Parker and her staff, and recently we also work with a contract lobbyist in Philadelphia who's had conversations with Councilmember Green and I believe some others. But most recently and most primarily Councilmember Brooks. We had a meeting last week, and Councilmember Brooks, you were very generous with your time, and we appreciate that, and we appreciate that conversation, and we hope to have more moving forward.
Okay, well, please don't hesitate to let me know. I'm on this committee, as are other council people. I think we have 5 members of council listening today, and while I'm very sympathetic to some of the things that you've said, it's the first time I'm hearing about it. I've never seen your amendments. I know nothing about it. And, the issues that can be raised could have been raised before today. I hear it for the first time. And so I think what's going to happen is we're going to continue on without any discussion, far as I can tell, and whatever discussion will happen after today. And I think that's unfortunate. And I've raised this before with your organization and others. If you want to say something, say it before the day of the vote. It's very unfair to us to hear things for the first time. We know nothing about it. We want to be fair, as the chairwoman said, but I'm hearing this for the first time. I have nothing in writing. I know nothing about it. But please, don't hesitate in the future to contact all the members of this committee. Thank you, Chairwoman.
Thank you. Thank you, Councilman. And I do think that, I'm sorry, Zach, did you want to respond to that?
We appreciate that perspective, Councilman O, and I'm happy to do that. I just started with PRLA about 9 or 10 months ago, and I'd be happy to connect with you not only on this subject, but with many of the challenges and pieces of legislation that we're working on. We did share amendments and suggestions with the prime sponsor of the legislation, and unfortunately, we did not share it with the entire committee. But nonetheless, we're happy to do that moving forward. And Councilmember O, I will certainly connect with you in the near future about all of this.
Yes, thank you very much.
So I was going to one moment, Mr. Carter. One moment, Mr. Carter. I was just going to say that I think what we probably want to do is gather the members of the committee and have some additional conversations around, your perspective, your thoughts, and previous conversations. I think it's just been a little scattershot, so everybody doesn't have all of the information and all of the knowledge that you may have around this particular issue. So we'll be working with the bill sponsor and trying to bring everybody together and make some additional conversations happen. So we'll be working on that. Okay. I'm sorry, Mr. Carter, you had a question?
I appreciate it, Councilwoman. The Restaurant and Lodging Association's amendments were included in what we sent around to council previously. I don't think Zach knew that, but having spoken with Andrew Zielinski, who represents you guys, we included those amendments in the amendments that we sent around to the committee over the weekend. Still, would love to have more time to talk about this, as the councilwoman just indicated she was willing to do it. We appreciate that, Councilwoman Bass.
Absolutely. Okay. And sorry, I'm having some technical difficulties going on here. Okay. And so I believe, we have 2 other speakers. I think, Amber, are you here?
Yes, I'm here.
Okay. Please state your name for the record and proceed with your testimony.
My name is Amber Smith, and I am speaking in support of Bill 220051. Hello, esteemed members of City Council and the constituents of Philadelphia. I am here today representing restaurant and other hourly workers in our fine city. I'm speaking as a former restaurant worker with a deeply enmeshed network of friends and comrades still working in the industry. I am currently an hourly employee in Philadelphia, and this law would affect myself as well as my coworkers. During the last wave of Omicron that spread across the city, many workers and their families were put at risk. A shocking number of restaurants across the city were not only not informing their employees of their contact with a recently positive coworker, but they were not ensuring their staff with paid sick leave or quarantine time. Many places decided to close last minute for the safety of their staff and patrons, but leaving their staff without much needed income. I run a small Instagram, and I asked employees at restaurants at some of the top cities. I heard from employees at some of the city's top restaurants run by celebrity chefs and restaurateurs that when they asked for sick pay, they were either outright denied or they were told that since the emergency sick paid leave had expired, they were not entitled to any compensation. I had a similar experience. I was exposed to COVID-19 and I was not entitled to coverage in my workplace as I had exhausted my accrued paid sick time. As I work with people who are high risk, it is imperative to be able to quarantine when necessary. My experience is that of many in the workforce today. As the current economic climate asks workers to subject themselves to this virus daily with little to no financial safety net, implementing emergency paid sick leave is critical to the workers of this city. I would also like to note the importance of the change, making it applicable to businesses with 10 or more employees, as many of Philadelphia's workers, and specifically restaurant workers, are employed by small businesses. I personally left the restaurant industry because of the lack of resources and financial safety nets in place, coupled with the outright dehumanization of the job and the employer asks of the restaurant worker. Implementing important worker-focused laws like emergency sick paid leave will ensure a better and healthier future, not only for the worker, but for the industry itself. Thank you so much for your time and consideration.
Thank you so much for your testimony. We appreciate your perspective. And we have another speaker on this panel. Walter, are you here?
Yes, good afternoon, everyone.
Good afternoon. Please state your name for the record and proceed.
Hi, my name is Walter Thomas, and I work at the Philadelphia International Airport, and I'm speaking on behalf of hundreds of workers at the airport. And the reason that the paid sick leave is important to us is because if any one of us gets sick and has to be out of work, it can bring stress and strain on us not being able to provide for our families or pay bills or rent due to being sick and not being paid for it. As of right now, we have at least 6 employees that's at my company that are out sick due to the COVID. And depending on how long that they're going to be out, they're not going to get paid for being out. So I don't know how it's going to really dampen their personal situation as parents and as workers in the workforce. And it's very important that the bill be passed on behalf of working families and anybody that's in a situation where they have to take off and they can't provide due to not getting paid for being sick. I would like to thank everyone for listening to my testimony. I appreciate your time, and thank you.
Thank you. Thank you so much for your testimony. Councilwoman Brooks, I apologize if I skipped over you. I didn't notice you until just now. Did I skip over you?
Yeah, I just was wondering, did we have an opportunity to get Jennifer Savala back on the line to finish her testimony or summarize it?
Jennifer, are you here?
She represents the small business owner, and I want to make sure that we get her on the record.
Get her the rest of her testimony.
Yes.
Councilwoman Brooks, I just got off the phone with Jennifer. I'm going to connect her via Teams audio in a couple seconds, if that's okay.
Okay, and while we're waiting for her, if we could have the clerk call the last 2 speakers.
Zelda Walker and Daisy Cruz.
Zelda, please state your name for the record and proceed with your testimony. Is Zelda here? No? Okay. Daisy, can you please state your name for the record and proceed?
Sure, Daisy Cruz. Good afternoon, Chair Bass and members of council. Like I said, my name is Daisy Cruz. I'm the Mid-Atlantic District Director for SEIU 32BJ, representing over 10,000 members here in the city of Philadelphia. Since the beginning of the pandemic, well over, unfortunately, 100 of our SEIU 32BJ members passed due to COVID complications. Additionally, thousands of our members have contracted COVID, and even more have come into contact with people who are infected. Each time they miss out on work, at least a week's worth of pay, they're missing out, and sometimes going out multiple, not only once but twice, multiple occasions, being sick or for whatever reason. Being affected with some type of COVID, they're missing out on thousands of dollars, just like Walter had talked about with his coworkers there. While many of us still have the comfort of working from home, our SEIU 32BJ members have been cleaning and securing our airplanes, airports, schools, hospitals, and office buildings, providing wheelchair services to passengers throughout our airports with the minimal option of social distance. Our members have been on the front line during this whole entire pandemic. Frontline workers are more vulnerable to contracting COVID-19 and are owed the basic protections that they need to keep themselves safe. During the beginning of the pandemic, frontline workers contracted COVID-19 at a rate of 55% higher than those who were able to work from home. This resulted in higher rates of death and, in some cases, long-term illnesses. These workers have kept our city running even during the most difficult periods of the pandemic, and deserve basic workers' rights. Public health emergency leave was passed twice before and has proven to be effective at keeping businesses open and workers safe. Despite some pushback from our corporate lobbyists, the previous 2 public health emergency leave laws were extremely successful. These protections help low-wage workers endure spikes in the pandemic and ensure that businesses weren't unknowingly passing COVID-19 onto the public. We're not in the clear, as we all know, and this pandemic has proven time and time again to be unpredictable. People are still dying from COVID, and they're still occupying hospital beds. And of all times, we should not take any risks, especially during this flu season. We cannot afford to take away basic protections like sick days from the workers that have been protecting us throughout this all. Philadelphia has to be the forefront on this issue, just like so many other cities. We cannot take away basic protections like paid sick days, and we should not put profit before people. Thank you for giving me the time to testify.
And thank you so much for your testimony. And Modesto, do we have Jennifer back on?
Yes, hello,
Yes,
can you
she's
hear me?
just connected.
Yes, we can hear you. Can we have you wrap up your comments from earlier? That'd be great.
Yes,
Mhm.
yes. Again, this is Jennifer Zavala from Wana Tamale here in South Philadelphia. I wanted to conclude that this bill is important for workers in the food service industry, frontline workers, but it's also for us as employers, just better business practice to allow people who are sick and affected by COVID to have paid time off. You cannot put a price on the human experience, and the bottom line causes desperation by people when they're not able to provide food or pay their bills because they are sick at no fault of their own. I wanted to conclude with that and say thank you so much.
Thank you for your testimony. Thank you very much for your testimony and for coming back. Councilmember Brooks, you have questions?
Yes, my first question is, can you hear me?
Yes, we can hear you now.
Okay, Madam Chair. It's for Jennifer. What do you say to those who might call this bill bad for small businesses like yours?
I would say that's just simply not the case in the sense if you have to pivot your business. There are larger restaurant organizations, larger restaurants that were able to get, restaurant relief, right? There was one particular collective that was able to get, I think it was like $16 million. To them, losing an employee is not that big of a deal, right? Their bottom line is not as important as it is for someone like myself. having taking care of my employees can put me in a better position because my employees want to come to work knowing that I care and respect their livelihood outside of that. So I think, saying that this is bad for business, it's really saying that you're, as a business, not able to accommodate the ever-changing landscape that is happening for every business now. When you're not able to get the things you're ordering through, is that bad for business? Does people know you for a particular dish or a particular experience? And if the supply chain has affected you, how do you pivot through that? Well, it's the same way if you have an employee who got COVID or whose family member or whose child is sick. You have to pivot and move. So it really says more about you as a business operator than it does about an employee who is sick and can't come in. That's what I would have to say to that.
Thank you so much, Jennifer, for your time and your comments. My next question is for Amber. Do you think more workers would be willing to stay in the restaurant industry if they were offered this type of benefit?
I absolutely do. I find it super important that we have paid sick leave. I mean, I know that even before COVID, it was the mindset that you showed up to work because there wasn't, either people aren't following the law and paying sick leave or letting their staff know that sick leave is available, or, in COVID, people, at least I heard from a lot of people that were extremely worried that they were being put to having to work with COVID, or were working alongside with someone who came to work because otherwise they couldn't afford to. I know that with newer industries coming out, people are switching careers, and that the talent pool is very shallow in the restaurant industry. I do believe that this is because there aren't worker protections in place, and that something like the emergency sick paid leave would keep people in the industry instead of looking for other options.
Thank you so much, Amber, for your comments. Madam Chair, that concludes my comments and questions.
Okay, well, thank you very much, Councilwoman. And I think, Madam Clerk, are there any additional panelists to speak today?
That concludes the panelists for Bill number 220051.
Okay, is there anyone else here whose name hasn't been called that wishes to speak on this bill?
Yes, Madam Chair, I'm Jennifer Rodriguez, representing the diverse chambers of commerce.
Hello, how are you? Please, we'll go ahead and state your name for the record and proceed with your testimony.
Absolutely. Yes, good afternoon. My name is Jennifer Rodriguez. I am the president and CEO of the Greater Philadelphia Hispanic Chamber of Commerce. Today, I testify on behalf of the Diverse Chambers Coalition of Philadelphia, which was formed by the African American Chamber of Commerce of Pennsylvania, New Jersey, and Delaware, the Asian American Chamber of Commerce of Greater Philadelphia, the Greater Hispanic Chamber of Commerce, and Independence Business Alliance, the LGBTQ Chamber, in order to work collectively as a community to meet the unique challenges minority business enterprises face when they engage with our local economy. Today, we come together to advocate for the diverse small business owners in the city of Philadelphia, urging members of council to engage with our coalition in the development and implementation of policies and regulations that may impact them. The businesses we represent are the backbone of our neighborhoods, providing essential goods, services, and employment opportunities to their fellow Philadelphians. Lowering the threshold of establishments required to provide COVID-19 leave to businesses with 10 or more employees will have major implications because it brings a very different business demographic within the purview of the ordinance. According to the census, there are 6,572 businesses with 10 to 49 employees in Philadelphia. These are businesses that, prior to this bill, have not had to comply with COVID-19 leave requirements. The change in policy proposed in Bill 220051 is of a significant magnitude and requires the engagement of affected parties. From our perspective, businesses of 10 to 49 employees have not had a meaningful opportunity to participate in a discussion about the benefits and challenges of providing COVID-19 leave. After all, they were not subject to the robust debate that took place to the prior enabling of the current law. Unfortunately, in crafting this bill, City Council did not engage with the members of our coalition, which represent many of the businesses that would be impacted, including grocers, restaurants, and small professional services firms. Coming as it did, without warning, only a few weeks ago, we cannot say what the direct impact of this bill will be on the many businesses we represent. But we do know that paid sick leave, without the availability of cost mitigating resources, will generally result in the increase of operating costs, which is a priority concern for the entrepreneurs we represent. As indicated in our recent 2022 to 2023 budget cycle diverse chamber small business survey, respondents to that survey, of which 91% were businesses with less than $1 million in revenue, clearly indicated a pressing need to lower the cost of doing business in Philadelphia. Small businesses in Philadelphia are at a very critical juncture in the recovery from the impacts of the pandemic, and there are causes for concern for our leaders and elected officials. The majority of respondents to our survey indicated that they would not recommend Philadelphia as a place in which to do business, with many respondents citing high taxes, high cost of doing business, and crime and safety concerns as primary detractors. In addition, when asked what Philadelphia government should prioritize in 2022 in order to create a thriving environment for small businesses, respondents ranked the lowering of taxes and focusing on the recovery of businesses most impacted by the pandemic among their top 3 priorities. As Council debates the costs and benefits of COVID-19 leave and other measures that may impact businesses and economic development, it should not lose sight that 33% of jobs in Philadelphia are possible due to the 26,000 small businesses with 1 to 50 employees that do business here in our great city. This is the category of businesses with the highest concentration of diverse entrepreneurs, and one which has the greatest potential for creating wealth and opportunity in the communities that would benefit the most. As business leaders, as community leaders, and as residents of the city, we must plan a safe, equitable, and robust economic recovery. The leaders, the staff members, and the boards of the Diverse Chambers Coalition of Philadelphia are ready to work with you to build a stronger and safer Philadelphia for all. Thank you. I'm happy to answer any questions.
Thank you very much for your testimony. Any questions?
Madam Chair, I have a clarifying question.
Certainly.
In your testimony, you said 6,000 or is 26,000 businesses that are less than 49. I wasn't sure of that number.
Philadelphia has 20, according to a study of the Commerce Department, United Way, and PIDC, Philadelphia has 26,000 small businesses with 1 to 50 employees. It has over 100,000 solo entrepreneurs.
Okay. Because
so the new category that has been added to this bill, which is employers with staff of 10 to 50 or 10 to 49, that is 6,500. So you're adding folks that were not covered under the current jurisdiction, and you're adding now because you're lowering the threshold. That's over 6,000 new businesses that are covered under the modification of the bill.
I get it. I understand, your perspective, and I thank you for sharing it. I would love to engage deeper with folks from not only just your chamber, but the small businesses that both you and Will Carter mentioned. But I also want to remind folks what I'm talking about. If it's 6,000 people that we're adding to this, 6,000 businesses is up to 60,000 people that we could be preventing from catching COVID. So I'm willing to have a deeper conversation with you, as well as Will said we talk to the big players. I want to talk to the business owners that you absolutely represent. So,
And
we,
so
instead
to
of
be
talking
clear,
to the heads, I'm okay with that. But if you're going to call me out and saying that I'm not talking to the small business owners, I need to make sure that I'm in conversation with the small business owners across the chamber, whether it's the African American, the Latino, or whatever. So if you can set time to set that up, I'm willing to have this conversation.
absolutely, and I will be talking to my colleagues from the Diverse Chambers Coalition, and we are happy to set that up. Thank you so much.
Thank you. And I think that concludes our hearing. I'm going to ask one more time if there anyone else to speak on this particular matter. And if not, what we're going to do now is come out of our public meeting and go into of our public hearing and go into a public meeting to hold the votes. And then we will come back and reconvene for our hearing on resolution, our firefighters resolution. So I'm going to ask.
Karen?
Yes.
I know there were some amendments circulated by the sponsor. If
Correct.
those amendments could be provide some additional information regarding the amendments.
Say again, did you want her to explain the amendments, Councilman?
Correct. I think there was a statement earlier made regarding the amendments, but just wanted to get some further clarification on the amendments.
Okay, Councilwoman Brooks, can you provide us with some clarity on those amendments that are circulated? You're on mute.
I'm sorry.
Candace?
I started.
That's okay.
First, we changed the sunset provision so that the bill expires December 31st of 2023, rather than 365 days after its effective date. We made this decision after feedback that the end of the year date is more workable for employers than a mid-year end date. We also made adjustments so that businesses with generous paid leave benefits are not required to provide additional leave under this bill. And we clarified provisions around certain labor negotiations and collective bargaining agreements. And we also included the heightened enforcement language that authorized periodic publishing of employers with unresolved violations as permitted by law.
And I guess the question I have is based on the testimony that Ms. Rodriguez provided from the diverse chambers to the sponsor, do those amendments address some of the concerns that she raised? I mean, my understanding from her testimony, and I know you had some businesses that testified in support of the business, but from my understanding from her testimony, there was a concern on the impact of this legislation to small businesses, in particular, small businesses represented by the diverse chambers.
So I think part of the testimony that I've heard is saying that the pandemic is over. It's not over, you know, and I think that that's an indication I want to put on record. The pandemic is not over, or we would not be under the mask mandate.
Totally correct.
And I think that when we think about the current labor shortages, we know that when workers are safe and feel safe, they can come to work every day. So we addressed many of the concerns that we had in both the meeting with PRLA and some also with the chamber. But I do believe that without this bill, people are being forced to choose whether to come to work or stay home and sick or lose their jobs, as some of folks testified. And my fear is removing or changing from 10 to 50, we put a large number of folks at risk, and saying that first I thought it was 60,000 people based on the number that she gave me, but up to 260,000 Philadelphians can be at risk from not having paid sick leave. And that's why we decided that we should keep the threshold at 10. I mean, I'm open for negotiation, but this is the sticking point that we have with both business community, and these have been the conversations that we have been in.
Now, I guess my concern, and I made this reference earlier in the conversation, that the number of businesses that closed, especially very small micro businesses in Black and brown community that closed due to COVID, and I definitely understand the need for this legislation as a whole to protect workers. but also at the same point, I want to make sure we protect workers by making sure they have an employer. And the concern that I've heard being represented from a number of small Black and brown businesses is that this type of legislation may impact their ability to survive, especially during a COVID period. Prior to COVID, and I supported and I voted for the legislation for earned sick pay at the 10 employee threshold. This legislation has gone through at least 2 iterations. The first iteration was at 499 employees, and it was 100% subsidy for those employees coming from the federal government. Then we had the 50 employee threshold and now the 10 employee threshold. And so the perspective of supporting and making sure that employees are safe is something that's very important, I think, from every member of City Council. But at the same point, we want to make sure that employees also have a business to go to. And if you look at the track record of a number of African American and Latin businesses that have closed, especially very small businesses, due to the pandemic, that's very concerning. And so that's why I asked the questions and want to get some additional perspective from your end. And so it's my understanding that you're going to meet with the diverse chambers, and through that, and my understanding that based on that conversation, there will be some additional perspectives regarding this legislation.
Yes, council member. I think that's why I brought that up, because they mentioned that we have not spoken directly to a diverse coalition of small business owners. So I put that on the table. I'm willing to have that conversation for us to, make those amendments based on a conversation with them. But I just ask that we voted out the committee and work through those amendments towards the council as a whole.
Okay, thank you. I appreciate that. Thank you, Madam Chair.
Thank you, Councilman. And I think that, as the Councilwoman said, she's open to some compromises and further amendments on the bill. And so we will be having those conversations. And so unless anyone else from the committee has any additional questions, and there being no further questions from members of the committee and no other witnesses to testify, I'm going to ask if there is anyone else present in this hearing whose name we have failed to call and that wishes to offer testimony of any of these 2 bills that were offered today. And I know we already did that. So I'm going to say that hearing none, I want to thank all the panels and witnesses for their participation today on bills number 210902 and 220051. We value your opinions, and I now invite all panels and witnesses from those 2 bills to please disconnect from the public meeting before we go into our from the public hearing before we go into our public meeting. We will now pause the proceedings briefly as multiple participants leave the hearing. Thank you very much for your attendance today. And this is only for bills number 210902 and 220051. We are going to reconvene for the hearing on the third matter today, which was our firefighters hearing on looking at the city's handling of cancer diagnoses within firefighters. Okay, and so I see that we have had multiple participants disconnect from the hearing, and I want to state for the record that this concludes the public hearing of the committee. We will now go into a public meeting to consider action to be taken on the bills before the committee today. Can we have Madam Clerk please call the roll and establish a quorum for this committee?
Yes, Madam Chair. Councilmember O.
Present.
Councilmember Gim.
Present.
Councilmember Green.
Present.
Councilmember Thomas.
Present.
Councilmember Brooks.
Present.
And Madam Chair, Councilmember Bass.
I am present. And okay, so now that we have taken a quorum of all of our members, I want to recognize Councilmember Brooks for a motion on the amendment to bill number 220051.
Thank you, Madam Chair. I'd offer an amendment to the bill number 220051. A copy of the amendments has been circulated to all members of the committee, and I move that this amendment to bill number 220051 be approved.
Can we get a second?
Second.
Second.
Okay, for the record, we want to recognize Councilwoman Gimm and Councilman Isaiah Thomas seconded the motion. It's been moved and properly seconded that the amendment to Bill number 220051 be approved. All of those in favor of the motion will signify by saying aye. Aye.
Aye.
Aye. Aye.
Anyone opposed? The ayes have it. The motion carries, and the amendment to Bill number 220051 has been approved. I want to recognize Councilmember Brooks for a motion on Bill number 220051 as amended.
Thank you, Madam Chair. I move that Bill number 220051 as amended be reported from this committee with the favorable recommendation, and further move that the rules of council be suspended to permit the first reading of this bill in next week's council session.
Can we get a second?
Second.
Second.
Okay, council recognize, or I want to recognize that it was seconded, I believe, by Councilman Thomas and Gimm. Okay, but it's been properly moved and seconded that Bill number 220051 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those in favor of the motion, please signify by saying aye. Aye.
Aye.
Aye.
Anyone opposed? No? Okay, the ayes have it and the motion carries. And also, I want to recognize Councilmember Thomas for motion on Bill number 210902.
Thank you, Madam Chair. I move for the adoption of the resolution.
Or that you move for that Bill number 210902 be reported from the committee with a favorable recommendation.
I'm sorry. Yep. Move for
That's okay. I know it's the same, almost the same language, almost.
Yep.
Can we get a second on that?
Second.
And the chair recognizes, was that Councilwoman Brooks?
Yes.
Second? Yeah, okay, very good. Chair recognizes for the record that Councilmember Brooks seconds the motion. It's been moved and properly seconded that Bill number 210902 be approved. All of those in favor of that motion will signify by saying aye.
Aye.
Anyone opposed?
Aye.
Okay, the ayes have it. The motion carries, and Bill number 210902 has been approved. And now we will go back into our public hearing around resolution number 210046. And if we could have the clerk call the first panel to testify, and while she's doing that, is there any opening statement from a member of council? Any members of council?
Yes, Chair, I'd like to make an opening statement.
Okay, Councilman O, please please begin with your statement.
All right, thank you. I just wanted to thank you, Chair, for holding this hearing. It is certainly an issue that has become public, and I want to thank Janice Armstrong for writing about this. I have been contacted by several firefighters regarding this issue and looked into it. It is about a presumption. A presumption is something that occurs by public policy or by law. We are all presumed innocent, for example, unless and until proven guilty beyond a reasonable doubt. In some legislation, for example, in the bill that we passed out of this committee to protect healthcare workers who are exposed to COVID-19, if that healthcare worker is working, for example, in the ICU full of severe COVID patients, their employer may say that you cannot prove that you got the infection at the hospital. Maybe you got it on the bus or maybe at a picnic. But the presumption is that because they are healthcare workers exposed to COVID-19, that they have to put forward a certain amount of evidence, and then it's presumed that they have a work-related illness. And so that is the case with state law. There is a policy and a law that provides a presumption that if the firefighter is able to show a threshold of a particular type of cancer, that this is something they do as part of their job, either paid or volunteer, that a presumption that they contracted the cancer on the job as part of a work-related illness, that is given to them. The question arises is, what is the response from the city, and to what extent is that presumption being accepted? Because of the nature of the hearing, being that we never know exactly what time these hearings occur, one of my witnesses, who is our expert witness, he did move his hearing at 2:30 to 2:45, but he told me in a text message he has to go to his 2:45 hearing. He will try to rejoin us. So at the very end of this testimony and hearing, I hope to bring on Michael Dryden. If not, we have his written testimony. I'll read it into the record. Thank you very much, Chair.
Thank you very much, Councilman. And that being said, Madam Clerk, if we could call forward the first panel.
For resolution number 210046, we have John Narkin, Michael Bresnan, Sherilyn Murphy, and Barry Scott.
Okay. And if we could proceed in that order, John Narkin, are you available and ready to proceed with your testimony?
Yes, good afternoon, Councilperson Bass and all the other members of City Council, and thank you for holding this hearing. I want to especially thank David O. for working hard to have this hearing scheduled. It's been a long road for myself and others, but I give all of you my thanks for holding this hearing. My name is John Narkin, and I have stage 4 cancer. My cancer started as soft tissue tumor in my lower back, where my self-contained breathing apparatus harness lands where I wear it. The cancer has since metastasized into other parts of the soft tissue in my body, as well as both my lungs and multiple ribs. For over half my life, the last 27 years, I've served the city of Philadelphia as a proud member of the Philadelphia Fire Department. While my cancer diagnosis was incredibly hard to comprehend, what was equally hard to understand was the way the city of Philadelphia has thrown me, my family, my fellow firefighter members aside in their denial of rightfully earned and state law mandated benefits. My fight and journey are not one that is uncommon within members of the PFD. Members before me have fought these benefits throughout the years, with some even fighting all the way up to the state Supreme Court and winning. But the city keeps denying these claims. My fight with the city started on May 7, 2018, when I sent a letter to the fire commissioner requesting coverage and benefits under Pennsylvania firefighter cancer presumption law. Less than a week later, I received a letter in the mail dated May 8th, 2018, the day after the commissioner's office received my hand-delivered letter denying my request. My claim was automatically denied. I was now in a battle against cancer and my death, but also the City of Philadelphia administration. The years that have followed can be described as exhausting, painful, as well as physically and mentally draining. I've undergone surgeries, immunotherapy procedures, infusions, immunotherapy pills, radiation treatments, cryogenic procedures which have tried to freeze the cancer in my ribs, chemotherapy pills, and chemotherapy infusions, none of which have stopped the cancer. It slowed it down, but each scan shows I'm closer to the time in which nothing can even slow the cancer down. I've seen multiple doctors all over the area and some even outside the state who are top in their field. They've not given me a timeline on what would happen, but the message is all the same. This condition will kill me sooner than later. January 2022 is National Firefighter Cancer Awareness Month. Throughout the month, the Philadelphia Fire Department went through great lengths to publish this and get the message out. Through the weekly update that's sent to PFD members, there were links to articles on firefighter cancer awareness, as well as safety bulletins published and distributed to its members. To help get the message out to the members of the PFD in the region, I was previously asked to give a video testimony of my battle with cancer that we used when the City of Philadelphia and Fire Department hosted a cancer awareness symposium in 2019 for our regional partners. This video was also shown at the beginning of the training session that all PFD officers were required to attend during our recent officer development courses. To quote, multiple cancer studies, including those released recently by NIOSH, have shown credible evidence and biologic credibility that link to higher rates of different forms of cancer in firefighters compared to the general American population. NIOSH recently undertook 2 large studies focused on firefighter cancer and concluded that firefighters face a 9% increase in cancer diagnosis and a 14% increase of cancer-related deaths compared to the general population of the United States. These are not my words, but the words of the Philadelphia Fire Department Health and Safety Office Bulletin distributed January 11, 2022. There are posters distributed and hung in all firehouses that tell us that firefighters develop and die from cancer at a much higher rate than the general population. It's been proven by a medical expert that my cancer is a result of my exposure to the chemical family called dioxins, which can be found to be present in numerous fires and hazmat incidents that I've responded to throughout my career as a Philadelphia firefighter and hazardous materials technician for the city of Philadelphia. The dioxins found in diesel exhaust fumes were present in all firehouses. The walls of the apparatus floors of many firehouses were covered with the soot from the apparatus. Our firefighting gear stored next to the apparatus was not cleaned on a regular basis for years in my career. The contaminants from fire to fire were consistently present each time we donned our gear. While improvements to the cleaning of the gear and capturing of the diesel exhaust have been implemented in recent years, it doesn't eliminate the exposure to cancer that we face every time we step foot into the firehouse to protect the city of Philadelphia. We're all inundated these days with the phrase, follow the science. So why not follow the science when it comes to cancer in Philadelphia Fire Department members? So why, again, the mixed messaging? Why is the city of Philadelphia and the fire department going through great lengths to warn us and eliminate some of the cancer risks we all face, but at the same time denying cancer is an occupational disease in firefighters? I don't know, and it seems like when it comes to do the right thing, the members of the Philadelphia Fire Department and their families, the city of Philadelphia turns its back on us. Firefighters die in the performance of their duties every day. We know that. From the day you step into the fire academy and each day you show up, the names of those in the line of duty killed are read out at roll call. To the alerts that each day notifying that another brother or sister has been killed in the performance of their duties throughout the country. I knew that each day I put on my uniform, kissed my wife, hugged my sons, and I went to work, that there was a possibility that I would not come home that day. It's something I lived with every day I walked into the firehouse. I know it's true. I did not die those days, thankfully, but I will die because I went to work those days. I'm being very vocal and fighting hard, not just for me and my family, but the fellow members of the PFD. We all deserve better than the treatment we've received from the city of Philadelphia. I'm here to ask you not just to do what's right morally, but to follow the laws and the science that help protect members of the PFD and their families. I thank you again for listening to me and my fellow members and the other people who you will hear from today, and hope that this is only the first step in getting what our families and members are not just entitled to under state law, but what they rightfully deserve. Our families have done nothing wrong other than be a family member of a Philadelphia Fire Department member. They should not have to suffer just to lose the loved one because of their occupation, but the hardship to fight a second time to secure their well-being after I'm gone. I live by the words from a song that's close to me. Bring the fight to this world while you can. Make the most of the rest of your life. Shine your light on this world while you can. I will continue to do that for the rest of my time I have on this world, and hope that you can help those very close to me and the many others who fight this city fight for this city every time they put on the uniform and serve the city of Philadelphia. Thank you for taking time today and listening to my plea for a resolution, and I look forward to any questions you may have when the time is appropriate. Thank you again.
Thank you very much. I did receive a text message from our chair who must step away temporarily, and she will return. But at this time, let me ask, are there any questions from members of this committee? If there are none, I have a question, and that is, could you explain to the member of the committee what difference does it make whether the city acknowledges that the State Cancer Presumption Act for firefighters, what difference does it make to you, to your family, and to other firefighters that presumption be acknowledged by the city?
For me, it's all about my family right now. I know when I pass on, the way things work is, my wife will receive a portion of my pension when I pass. The thing for my wife, who does have a disability, is the medical benefits. The way it is now, if my cancer is presumed to be line of duty death, which it should be, my wife receives lifetime medical benefits. Other than that, and one of the reasons why I've gone through treatments, I've gone through radiation treatments during the day and showed up at work that night and worked all night long. I did that for weeks because I was trying to save my sick time for my wife, because she would need the conversion that we could do when we retire. She needs those medical benefits. For me, that's what it's about. It's not necessarily for my coverage and my treatment right now. It's for who I leave behind in this world. It's for my family. It's for them to be taken care of. My wife's, I'm 51 years old. Okay. I had a long life ahead of me. Okay. I may not be here to my 52nd birthday. I may not be here to my 53rd birthday, but there's no reason why her and the rest of my family should have to suffer financially and things like that because I chose to go to work like this. The law is out there to protect people like me. The law is out there to protect other firefighters. That's why the state, in my opinion, passed this law. And that's why I think the city of Philadelphia should abide by the law and, give myself and other firefighters who have died of cancer and are fighting cancer right now those benefits that they deserve. They shouldn't have to use all their time up and, rely on people for donations in the sick bank and the catastrophic relief bank. They shouldn't have to do that. This is a work-related illness that needs to be covered under the city of Philadelphia.
When you signed up for this job, you understood that you were putting your life and health at risk, and you did so willingly. But your family, and this is true of all first responders who step up to take on these hazardous duty jobs, your family has been there with you through this entire time. In your opinion, and in your experience, does this presumption, does that include the idea that neither you nor your family should suffer unnecessarily?
Absolutely, Ken. I could have said it better. When this law was passed years ago, there was a great sense of, I want to say, relief throughout, the members of the fire department, because now we knew, and I've seen multiple people that I worked with and loved dearly, shortly after they retire, pass on from cancer. I've seen people on the job that I've worked with pass on from cancer. And then knowing that, when this law passed and knowing that happened for me personally, I felt a sense of, I guess you could say, relief to a point. Because I know if for some reason, I knew that if I died in a fire the next day, I've been to those where our members were killed in the line of duty. If I died like that, I knew my family was going to be taken care of. I knew that was, a line of duty death and was going to be taken care of. They died from an occupational injury. When this law was passed and it made a cancer diagnosis an occupational injury for firefighters, it gave myself and other firefighters a sense of relief that the city would take care of our families because we put on that uniform every day. And that's what it did for me. It knows that my family would be taken care of afterwards. That's the main point of all this. And this is why we're fighting. This is why I'm fighting. This is why you're going to see other members, talking about that and fighting for this. It's to give our family a sense of security, knowing that, yes, my wife has been beside me this whole thing. My friends have been beside me. My members of the fire department have been beside me the whole time, through treatments and things like that and being sick and not being able to move. But knowing that they're taken care of after I pass on, if the city does the right thing and approves these claims like they should, knowing that it makes going to work a little easier, to be honest with you.
Thank you very much. Are there any questions from the other members of council? There being none, I'll ask the clerk to call the next witness.
Thank you, Councilman. The next witness is Sherilyn Murphy.
Good afternoon, Councilman O and the other members of the Public Health and Human Services Committee. My name is Sherilyn Murphy. I'm the Risk Management Counsel and the Employee Disability Manager for the City of Philadelphia. And with me today is Barry Scott. He is the Risk Manager for the City of Philadelphia. We want to thank you for the opportunity to provide testimony on Resolution 210046, which authorizes a hearing to examine the city's compliance with the Pennsylvania Firefighter Cancer Presumption Law. Mr. Scott is going to provide the testimony, and I'm available afterwards for any questions that you might have. Mr. Scott? You're muted. Mr. Scott, you're muted.
Thank you. Thank you very much, Councilmember O and council members and members of the gallery. My name is Barry Scott, and I'm the Deputy Director of Finance for Risk Management. And I'm here to provide additional testimony today on Resolution 210046. Cancer is a commonly occurring group of diseases with various causes, not all of which are occupational. Act 46 added a new occupational disease category to Section 108 of the Workers' Compensation Act and identified the class of firefighters who were eligible for the presumption in Section 301F. The term occupational disease shall mean in that section, in Section 108R, cancer suffered by a firefighter which is caused by exposure to a known carcinogen which is recognized as a Group 1 carcinogen by the International Agency for Research on Cancer. Section 301F states, compensation pursuant to cancer suffered by a firefighter shall only be to those firefighters who have served 4 or more years in continuous firefighting duty, who can establish direct exposure to a carcinogen, and have successfully passed a physical examination prior to asserting a claim or prior to engaging in firefighting duties, and the examination failed to reveal any evidence of the condition of cancer. The presumption of this subsection may be rebutted by substantial competent evidence that shows that the firefighter's cancer was not caused by the occupation of firefighting. Here, non-occupational risk factors are relevant, such as family history of cancer, cigarette smoking, alcohol consumption, and genetic markers. To facilitate an investigation and eliminate unnecessary litigation, in 2018, Local 22 and the city agreed upon a process that would be followed when investigating firefighter cancer claims. According to this agreement, firefighters who claim benefits for cancer sign an authorization to release medical records and fill out a questionnaire that was developed with the involvement of Local 22 of the International Association of Firefighters. The questionnaire focuses on the firefighter's fire service, risk factors for cancer, such as smoking history or alcohol consumption, family history of cancer, provides a list of medical providers that the firefighter has treated with in the past. Once all of this information is gathered, the city's third-party administrator for workers' compensation claims comes to a decision about the compensability under state law of the individual firefighter's claim, taking into consideration the legal standards for application and rebuttal of the presumption described. The city has unilaterally accepted multiple cancer claims since this process for investigation was implemented. An example of an accepted claim involved a firefighter with esophageal cancer. He was a non-smoker with no other risk factors. Another firefighter who has bladder cancer had his claim accepted after an investigation uncovered no personal risk factors for bladder cancer. Several skin cancer claims have also been accepted since 2018. In the event that the city does deny a claim, the firefighter may place the case into litigation. Once litigation is instituted, the opportunity for discovery is greater than in the first-tier investigation conducted by the third-party administrator. The city has the ability to obtain testimony under oath from the firefighter and other witnesses. The city has the ability to subpoena medical evidence, and both parties have the opportunity to obtain expert opinions for or against the claim. It is often at this stage that the first evidence of medical causation is produced. Thank you, panel, for the opportunity to provide testimony, and we're happy to answer questions that the committee may have.
Thank you very much for your testimony. Let me start by asking if any member of the committee has any questions. There being none, I do have a question for you. In this process, it appears that there's a low threshold for a firefighter with cancer to overcome, and that is to show that they have worked for 4 years or more as a firefighter, that there is a possibility, under the law, a possibility that the type of cancer in group 1 is something that they have contracted, and then the burden shifts to the city, which needs to affirmatively prove that the cancer could not have been contracted on the job. Is that your understanding?
Councilman O, I would take that question. That is a good summation of the law, but on causation, the employee does have a burden of causation to prove. And you did state correctly that that is a general causative link between a group 1 carcinogen and also the specific type of cancer that the employee has. There's also time constraints that are imposed upon these cases. You also indicated correctly that there has to be continuous firefighting duties for 4 years. There also has to be a pre-injury cancer-free diagnosis, and there has to be a direct link between the group 1 carcinogen and the cancer that the person has. So once these elements are met, then the presumption takes place. But we want to make it clear, Councilman O, that there are conditions precedence to the presumption coming into play. And it's not just a matter of whether a person is a firefighter and then they have cancer and then their claim is compensable. No, risk factors are very important at this stage of the investigation. And the first stage of the investigation is one that is conducted by our third-party administrator. And oftentimes at this initial stage, there's not a lot of evidence that's available, and we have to rely heavily upon the injured worker and upon the union to get information to us. And since 2018, we have worked closely with the union to make sure we get the information that we need so that we can make an appropriate determination as to causation. You're correct about the presumption that the employer has to establish under this area of the law, but risk factors and genetic markers, those are things that certainly come into play when you're trying to make this initial assessment as to causation within the time period that you have under the Workers' Compensation Act, which is 21 days.
Thank you for that explanation. What does the presumption, in other words, under the Pennsylvania Firefighter Cancer Presumption Act, what do you understand the presumption to mean?
I can give you my personal understanding, but I do want you to
I'm going to straighten this out because your personal understanding is what seems to be important in terms of the city's position.
I was going to give you the answer because we have experts that are outside of the city, our third-party administrator, and those are the folks that have the expertise in this area. They are the ones that do the initial investigation for the city with the oversight of risk management. So those are the folks that do the initial determination as to whether or not the employee has evidence that they provide that establishes their burden of going forward with evidence or burden of proof on the initial stage of whether or not the presumption even comes into play. When we're making that initial determination, we're not seeking to rebut the presumption at any point. We're looking for evidence or information that the person has a cancer, that the person was exposed directly to a group 1 carcinogen, and that the person has the requisite period of service, and that the person was cancer-free. We look at risk factors when we make that initial determination before the burden moves to the city to establish anything. There has to be, and I'm going to speak in lawyer terms, which I know you are full aware of this, you practiced, that there's got to be some type of prima facie case. There's got to be some elements established to meet the initial burden of causation that the employee has to meet before the presumption ever comes into play. So I can tell you what my understanding is of the presumption because I'm going to quote, from the Slated case that the Pennsylvania Supreme Court stated, and they said that there has to be substantial evidence, and they're quoting from the legislation, that there is a specific cause for the individual's cancer that's other than work relationship. So there has to be an independent cause that's not work related. That's what the court says, the presumption that can be rebutted by the employer. We're not talking about general causation, we're talking about something specific, and that was from the Slated case, and that comes directly from the language of the statute.
Thank you. I do have as a witness a gentleman you're very familiar with, Michael Dryden, who in fact represents Chief Narkin and others. However, he is unfortunately scheduled for a conflicting hearing. I hope he can get back to us before the end of this this hearing. However, I do have his written testimony about the case and the interpretation of the case, and it seems to me where we are is it seems to me that we are at a place of disagreement between Michael Dryden and perhaps your third-party administrators on what presumption means under the law. And I suppose perhaps, that is an issue that we're trying to understand at this point in time. I know we cannot go into any individual case, but collectively, the cases seem to be one where a presumption is a purposeful decision about not contesting very difficult proofs for public policy reasons. And if the third-party administrator or the risk management or the law department is fighting in a very vigorous and aggressive manner, that goes beyond the presumption. And that's just an exploration of where we are. So I don't want to belabor the point. If you have something to add, please do. If not, I'll leave it at that.
Councilman O, the only thing that I wanted to add is to assure you and every other council member and everyone in the audience that the city is definitely complying with the firefighter cancer presumption. We take these cases very seriously. We investigate each case on a case-by-case basis. We reach out to the employees to get their side of the story as to what happened. We try to get as much medical information as we possibly can within a condensed period within which we have to do these investigations. And we are working very hard alongside our TPA, as the third-party administrator, to make sure that all of our employees who are entitled to benefits under Act 46 get those benefits. So we are working hard to be fair and to do what's best not only for them, but also for the city. And Mr. Scott, I didn't know if you had anything to add to that.
I did, if I may, because really, and thanks very much, I think everybody here knows and is aware that that cancer is as a number of diseases, and the path of causation is not at all clear. Medical information is complex and needs to be gathered in order to make those kinds of determinations about cancers. And sadly, cancer is very common in this country. And in fact, in the city, and in fact, the Pennsylvania city has a higher rate of cancer than the state. And so there are a number of people in Philadelphia who will come down with cancer that has absolutely nothing to do with their jobs. And so part of what we're charged with doing in risk management, then we pass that responsibility on to our professional third-party administrator who we charge with making these determinations, is evaluating the law, making the appropriate compensability determinations, and following the law in terms of making those determinations. So we are looking to do that in every case. And so that's what I just wanted to add to what Ms. Murphy already said.
Thank you very much. I see our chairperson has returned. Thank you very much. I'll just note that I appreciate your testimony. It is in dispute. The city, of course, hires the third-party administrator, and basically it's a competitive bid where they will do what they are hired to do. If they don't do what they're hired to do, they won't have a contract. But I appreciate your testimony, and I'll return it to our chairperson. Thank you.
Thank you, Councilman. I appreciate your covering for me for a few minutes. I had to step away, unfortunately, but I am very much obviously interested in this issue because as the Chair of Health and Human Services, we want to do right by our city employees who are putting their lives on the line. And where we have situations like this where, we have a number of folks who have been diagnosed with cancer who have not been, in my opinion, fairly compensated and supported by the city of Philadelphia as they have been doing their job. I think that we need to look into it and look into it further and, continue this conversation well beyond this hearing today. So thank you, Councilman.
Chair, if I could just update you, I did get a text message from our expert witness, one of our expert witnesses, that is Michael Dryden. He had to join another hearing. He texted me to say he'll be available in 10 minutes.
Very good. Very good. Thank you. So do we have additional folks lined up as folks to testify, witnesses to testify on this hearing, yes. Madam Clerk?
Yes, Madam Chair, we have Mike Bresnan.
I see Mike is here. Mike, do you want to state your name for the record and proceed with your testimony?
Yes, Councilwoman Bass. It's Mike Bresnan, and I'm president of IFF Local 22, Philadelphia Firefighters and Paramedics Union.
And please begin your testimony.
Okay, I don't have any written prepared testimony. However, I would just like to touch on a couple things. Mr. Scott's been around a long time, as well as I have, and Chief Narkin. And he could just check that box off right now as members like myself and Chief Narkin have a smoking history. Yeah, we do, because for years in the firehouses in this city, the diesel exhaust from those trucks filtered the whole firehouse. The sleeping areas, the berthing areas, the kitchen areas, and the city fought us tooth and nail to get a system to expel those fumes from the firehouses. And at one point, they actually put these horse crap recycler systems that were hung from the ceiling that did absolutely nothing. They spent millions of dollars on it. They had to be taken out, and finally, we got the system we have now, which is called a source capture system. And if you go by a firehouse, you may see it. It's a large yellow elephant trunk hose that hooks to the apparatus exhaust. And as the truck starts and leaves the station, it follows it out and on its way back in. So it does a very good job of keeping the diesel fumes from the members. And I'll tell you another thing from having 27 years on the job. No matter what the fire is, whether it's a rubbish fire outside, auto fire, a house fire, building fire, we are saturated with carcinogens from that smoke. There's particles in that smoke. And I know you've been around, Ms. Bass. You've probably seen many fires in this city. You can see it in the smoke plumes. And I want to go back to, I said this earlier. The mayor could fix this tomorrow with Chief Narkin. And one thing I think people elected in office forget sometimes, and I'm not accusing anybody on this panel, and most of you know this, your number one job is public safety, to protect the public. And when firefighters, police officers, etc., EMS providers, we're on the front lines, we're looking for you to protect us. And in this case, John's not being protected. And back, I looked at an article, I remember seeing, I found it today. It was back from December 23rd, 2015. It was a Philly Voice article. I just want to read a quick couple sentences from it. It said, on January 4th, Kenny, 57, will be sworn in as 99th mayor of Philadelphia, but he wouldn't have arrived here without the early influences he received from 2th Street neighborhood, where he learned loyalty. And when I seen loyalty, there's no loyalty here now to Chief Narkin. And the next paragraph, it talked about Mayor Kenny's father. Kenny's early memories of his household were knowing when his father was home. The pungent smell of burnt wood and rubber would waft through the small house, signaling Dad was there for 4 days in his 4 days off first. So that's too, even he knows. You come home with this. It's in your hair. You go to a fire. You wash your hair. You smell it. So this is completely outrageous. The third-party administrators should look back to the diesel exhaust that was expelled through the stations when the top of the walls and the ceilings were black with diesel exhaust. So a little history needs to be put into place with the third-party administrator, especially in Chief Narkin's case.
Well, I could not agree with you more. I've been to every fire station in my district, and I know the conditions, the environmental conditions in those buildings is just really outrageous and have been for decades. I mean, you know, like these facilities, and, you know, we ask people to essentially live there, as you mentioned, for 4 days on, 4 days off. These conditions are totally unacceptable. And, you know, if I know it, then I know, you know, doggone well that the administration knows it. Everyone knows it. And the fact that we haven't been able to get a stronger commitment to address some of these environmental concerns and conditions is really just unacceptable. Like I said, I've been in every fire station in my district. I know, you know, some of the things that I've seen which really shouldn't fly. I'm talking about raw sewage in the basement. I'm talking about mold and mildew. I'm talking about, you know, exhaust fumes and not without the proper ventilation. And these are things that have existed for many, many years. So it's no wonder that, you know, people would get sick. You know, it's a miracle, you know, and I knock on wood, thank God we don't have even more people sick, you know, but we don't want that. But we do want for the city to recognize that this has been an ongoing problem for a very long time, and it needs to be addressed, and it needs to be addressed with workers first and buildings very closely second. It has to be addressed as soon as possible. So thank you, Mr. Breslin, for your testimony. I see my colleague, Councilman Mark Squilla, has his hand raised for a question.
Thank you, Madam Chair. And how long does the administration take to review a claim when a claim is first initiated?
So under state law, the city has 21 days to make a decision whether or not to accept or deny a claim. And as I mentioned earlier in my testimony, after discussions with Local 22 in 2018, we set up a process to address this kind of claim specifically because of the volume of information that was necessary in order to make even the very basic determination with regard to compensability on the claim. And so that process we have used, and I think we've used it effectively to get the exchange of information that we needed in a timely fashion in order to make determinations with regard to claims. It is not just, you know, what information, frankly, it's just information gathering is a huge challenge. You know, it's very common in these kinds of cases that there are a number of medical providers which are involved. And those providers have been providing information and providing data. That information must be collected from those providers to be evaluated to make a determination with regard to the claim. And so it is that collecting of that information, the review of that information in order to make the determination that that takes the time.
So why is it then that if that takes all this time that these claims seem to be denied automatically within like a 24-hour period?
Chief Narkin's claim is I think the only claim that I am aware of that was denied in that kind of time frame, and it was an anomaly, and that is not typically what happens with regard to those claims.
So are we saying it was a mistake?
No, we're saying that 24 hours is not what typically happens, that we are still within the 21 days window that we have in order to evaluate it. But what happens that 21-day window was not used to its best effect in the case of Chief Narkin's claim.
So have we corrected this in the future that, or did anybody else ever receive a notice in 24 hours?
So we have, again, after we met with Local 22 and worked with them to institute a process for these cancer claims, that process has changed, and that we have not had anyone else who has had their claim denied in its initial 24 hours after submission.
All right, because it's just so, in this case, it was just denied, and you're saying it's an anomaly. So we didn't take any of that information into account on this particular case, but every case since then you have.
So we have, as in workers' compensation cases, a worker files a workers' compensation claim, and the employer has that 21 days under state law in order to accept or to deny that claim. Even if the employer denies the claim, the employee has the right to continue to pursue that claim and provide evidence that the claim is valid, and to be successful in getting the employer to compensate that claim based on information that the employee provides. And so while and that information then also goes before a finder of fact in order to make the determination as to whether or not the claim is valid. And so even in cases where claims are denied, as Chief Narkin's claim was denied in this case, that is frankly a place where this process still has an opportunity to have a worker's claim accepted and compensated.
So at this point, so then are we saying that at this point now it will be compensated?
No, what we're saying is that, and so with regard to Chief Narkin's claim, which is currently in litigation, we're not going to be, sort of providing any specific information with regard to this claim. That process is ongoing with regard to this specific claim.
And just for the record, I mean, I know Mr. Narkin personally, and remembered when this was happening and what the family was going through and the challenges that we as a city have. And it just seemed to be very unfair at that time, and not because I knew him personally, but just unfair to the fire department. And when we first broached the subject, it seemed to be, all right, we need more time to review it. It just seemed like the city was uncaring or unwilling to look into this, and then seemed like we were waiting out this issue until maybe something happened in the long run. It just felt bad. It felt bad from the city perspective. It felt bad as a council person representing a constituent, and I'm glad to hear that this will never happen again. But my fear is that when we have these issues come to us, if we are not going to be transparent and then actually review these in a way that people believe that we're taking them serious, it'll be a real challenge for us here on council to be able to support these decisions by the administration. So I think we as council need additional answers. I think the fire department needs additional answers, and I really do think that Mr. Narkin, his case, I know you say it's in litigation now, so it'll be decided through the courts, but it should have never got to that point. And I think that's part of the challenge that we feel in council, and we feel responsible for this. And as we represent the city and all the departments in the city of Philadelphia, I think we have to make sure that we are fair as a city, and we're making sure that we could say, we took every consideration in this case. And I don't think we could say that right now. And that's, I think, the difficult part. Because we didn't take every consideration, since the anomaly was it was just a 24-hour turnaround of rejection. And so, I think we need to do a better job. Thank you.
Thank you, Councilman. I would agree. I would absolutely agree. Councilman Green has a question, and then we're going to go to our expert witness, Mr. Michael Dryden, Esquire, who is here and able to testify. Councilman?
Thank you, Madam Chair. Thank you, Mr. Narkin, for your testimony, and thank you, Councilmember O, for bringing this issue in greater attention to the Public Health and Human Services Committee. Mr. Scott, just wanted to get some perspective, and I understand from what I heard in your testimony and the colloquy with Councilmember Squilla and others that this anomaly, as you referred to, has been corrected.
That's correct.
Okay. And so in receiving a claim, there are certain steps that are done by the administration to evaluate that claim. And so what are generally those steps that occur when that evaluation happens of a claim in a brief perspective?
Certainly. We request some information from the claimant about the claim. That's especially critical in the cases like of a disease as opposed to an injury. It's also important in an injury that we get information from the claim. That's usually done on an accident and injury form that the city uses. However, in cases where there's an allegation of a disease, that there's information that we need to get in order to say, what the disease is specifically, what the relationship that the disease has to the employee's employment in order to make the determination for compensability. In general, that's the information that we're looking for with regard to a work-related illness that someone is alleging.
And ultimately, who makes the decision on a denial of a claim once that information is received?
So it is. So we hire professionals in the field whose business it is to work on workers' compensation programs, either locally, regionally, and nationally based third-party administrators who provide that service to the city. As Councilman O indicated, these are provided through our typical city contracting process. And so it is a professional firm whose job it is to evaluate claims of work-related injury and illness and make compensability determinations and handle the administration and management of those claims, as well as the medical care and related to those claims.
And so what type of oversight does the city provide to those providers that handle this type of work?
So the city's risk management division, under its employee disability program, provides oversight. We have Sherilyn Murphy, who is our employee disability manager and also is risk management counsel. She is employed through the law department in risk management to oversee the employee disability program. In addition, we have a medical director, Dr. Marilyn Howarth, who provides a medical oversight for the program in its entirety. We also have other risk management staff who work addressing issues of various information and processes who involved in the handling of claims. Those are some of the folks who are involved in overseeing the program to assure that it's running correctly, as well as myself. I'm also there looking at it to oversee what is going on.
So once this third-party entity makes a determination, do they provide that determination to the city employee directly, or does that come through the city of Philadelphia before that goes to the employee?
So I believe that in most instances their determination is going directly to the employee.
So if it's going directly to the employee, how are we providing oversight of those entities when those entities are making that determination and the determination is going directly to the employee? And you have situations like this where within a 24-hour period, from my understanding, this entity, based on what you provided, was supposed to receive certain information from the employee, review it. How could that occur in a 24-hour perspective? And how can the city provide oversight if the entity is providing information directly to the employee and we're learning about this anomaly after the fact?
So as I said, after this incident, with this particular claim, we have edited our process in order to assure that that there is, in fact, a greater exchange of information, and we have increased our oversight in risk of this process to assure that we are considering all the aspects that need to be considered before we make a determination of compensability for a claim.
So my understanding, based on this situation, that going forward, that determination will go from the city to the employee after they receive the determination from the third-party administrator? Is that how we're providing the oversight now?
So, and I don't believe that it's coming directly from risk at this point still. However, risk is involved in reviewing those determinations prior to going out to the employee.
And that's the change you articulated earlier that will stop this situation from occurring again.
That's correct.
Okay. Thank you, Madam Chair.
Thank you, Councilman, for your questions. And now we're going to turn to Mr. Michael Dryden, Esquire, who is our expert witness. Mr. Dryden, are you prepared?
I am. Good afternoon, Chairwoman Bass. How are you?
I'm very well. How are you?
I'm okay. I'm sorry I had to step away because I had a hearing that I had to attend to prior to getting back. So my prepared remarks had included sort of a history of where we came from the law. I know with some of the witnesses you have, Dr. Scott, and I don't know if Ms. Murphy testified, you may have already heard that. But in some ways, I'm going to give you a brief history just because I think it's important to our version of how this should run.
Okay, please state your name for the record and then proceed with the testimony you want to provide.
Yes, ma'am. My name is Michael Dryden. I am the head of the Workers' Compensation and Occupational Disease Department at Willig, Williams, and Davidson. I'm a law firm in Philadelphia that is not actually, as we sit here, counsel specifically to Local 22, but I represent several Local 22 firefighters in cancer claims and have evaluated probably about 250 firefighter cancer claims since this law was passed. I would like to begin briefly with some history of the law. It became law in July of 2011 when Act 46 was signed by the governor. What happened was that the legislation amended Section 108 of the Pennsylvania Workers' Comp Act. Occupational disease in Pennsylvania Workers' Comp is actually a term of art. It only refers to the diseases listed in Section 108, and the Act 46 amendments placed cancer that is caused by an IARC Group 1 carcinogen will be considered an occupational disease for a firefighter. It added that definition to the list of a potential occupational disease. It also added Section 301F to the Pennsylvania Workers' Comp Law, which sets forth a criteria that a firefighter has to meet in order to make the claim. They have to have at a minimum of 4 years of continuous fire service, exposure to what are called known human carcinogens, really specifically identifying the International Agency for Research on Cancer, which I'll refer to as IARC, which is an agency of the World Health Organization that grades and rates different, even occupations, agents, chemicals as for their carcinogenicity. And then the firefighter has to, if he's a career firefighter, he has to have had physical exams prior to being diagnosed with cancer, and those exams were benign prior to the diagnosis. Essentially, the law sort of says you have to not have had cancer before you had cancer. It's a little bizarre and not something that really is in any way an issue here, because most firefighters have some form of physical before they begin their career, and in their personnel records, we're obviously able to establish that they did not have cancer like Chief Narkin prior to his cancer being diagnosed. That was the law as provided by the General Assembly. And that, as I said, happened July of 2011. From July of 2011 until 2018, we fought like cats and dogs over what that language meant. And when I say we, I mean myself and counsel for different insurance companies, including the ABLE counsel that the city of Philadelphia has handling these claims. We fought for different interpretations of the law. In 2018, the Supreme Court of Pennsylvania decided the Sladek decision, S-L-A-D-E-K. Mr. Sladek is a chief in the city of Philadelphia fire department. He's still active. His case set the burdens of proof placed on a firefighter making a cancer claim in Pennsylvania. Of note, and when the Supreme Court decided this case, is that they were very, very clear with the burden of proof. They laid out the firefighter's initial burden as a two-step burden, which was first to show that that firefighter was diagnosed with a cancer that's a type of cancer possibly, and that's a key word in this, possibly caused by an IARC Group 1 carcinogen. So if the cancer is a type that's possibly caused by an IARC Group 1 carcinogen, the firefighters met that initial burden. The IARC publishes a lot of literature that we've used in these cases, which I think makes or provides definitive proof of the carcinogens that are related to specific cancers. And they provided literature in what's called Monograph 98, a specific evaluation of firefighters about the carcinogens found in smoke and soot. I can tell you page 401 to page 403 of Monograph 98 will provide a laundry list of the carcinogens men like John Narkin were exposed to in smoke and soot. He's also been exposed for much of his career to diesel emissions, because while the city now does have diesel capture systems in their firehouses where those trucks are hooked up so that the exhaust gets pulled through scrubbers and put out into the atmosphere and pulled out of the firehouse, for years they didn't have them, and many times didn't have them operationally. And even now I'm told from some of my clients that there still are some problems with that. So that means that when the firefighter's in the firehouse with the truck running, if I shut my mouth for 3 minutes and we just watched an engine run, the room would fill up pretty quickly with diesel emissions. Monograph 105 from the IARC at page 41 provides a laundry list of carcinogens that you'll encounter when you breathe in diesel emissions. So those documents, that information from the IARC, when coupled with another document from the IARC that lists carcinogens by cancer site, makes it pretty straightforward these days to be able to say what cancers are related or possibly related to Group 1 carcinogens. Kidney cancer, liver cancer, leukemia, non-Hodgkin's lymphoma, multiple myeloma, malignant melanoma, just to name a few, are cancers that are clearly related to Group 1 carcinogens. Mr. Narkin's cancer is a soft tissue sarcoma, which is related to dioxin. Dioxin is an important chemical in the world of carcinogenicity, especially for firefighters, because it is present in smoke just about at every fire, and it is present in diesel emissions. So every time a firefighter like Chief Narkin was exposed to diesel emissions without a mask on his face or smoke or soot, he was exposed to the carcinogen that's related to his type of cancer. And that's where, when I came in, as I heard Dr. Scott, concluding his remarks, I think that what I struggle with this is this law is now matured, and in maturing, we do understand what cancers are related to Group 1 carcinogens. The second phase of this, the Section 301F criteria, no one's ever disputed that with Mr. Narkin. He's got way more than 4 years of continuous service, and he's got exposure to carcinogens, and he had clean physicals. What happened here, and why it only took PMA, not the city, not Dr. Scott, not Ms. Murphy, but PMA, why it only took them 24 hours to decide to deny Mr. Narkin, was he has a very rare form of soft tissue sarcoma. So when they saw that, somebody there said, aha, here we go. Here's our defense. This is how we're going to defend this claim. We can say no to this firefighter because he has this rare form of soft tissue sarcoma. So let's throw him to his proof. Let's make him go find a lawyer, make him go find an expert to be able to establish this case. I think that, kind of that's at the heart of what I see as the problem, really, for not just the city of Philadelphia, but several municipalities now that this law is more than a decade old, is that they've outsourced the decision on whether one of their public safety employees is going to get a benefit for cancer to basically an insurance company. And that insurance company does what you hire an insurance company to do, or what they generally do, in my experience as someone representing injured workers for 30 years, is they sniff out the defense. If there is a 2% chance of a defense, they are going to take it. They're going to take it and say, okay, well, we're going to say no to this guy and put him to his proof because there is no data on Mr. Narkin's very rare form of soft tissue sarcoma. But under the way that I read our law is that the law specifically references the IARC. When you go to the IARC, there is no subtype for Mr. Narkin's very rare type of soft tissue sarcoma. But they do tell you that soft tissue tumors are related to dioxin. So my belief, and I don't want to speak for Chief Narkin, and I'm certainly not here for the union, but my belief is that if maybe we had some city employees who were making this decision, and we could go to them and say, hey, look, this soft tissue sarcoma is related to dioxin. He's covered there. Dioxin is a group 1 carcinogen that's related to his cancer. He made the 108R. You're never going to contest any of the 301F criteria. Now, the only way, according to the Supreme Court in Slavic, once we get that far, the only way they can defend the case, the burden flips on the municipality. They have to bring evidence of the actual cause of the firefighter's cancer. They have to establish a non-firefighting cause for his cancer. Many times that's not even attempted. It's just putting the firefighter to his proof to bring this very, very specialized, very, very technical evidence relating a carcinogen to a cancer that I think is, when you understand what you're doing and you know who to talk to go elicit that opinion, is pretty straightforward for me to get. But for a firefighter to show up with it in the beginning of the claim, or to provide that information at the beginning of the claim, I think is impossible. And I think the way the system's set up, they know it's impossible, meaning PMA. So because Chief Narkin didn't come in and say, I have a very rare form of soft tissue sarcoma, and soft tissue sarcoma is related to dioxin, and that means that I meet the initial burden of Section 108R, and here's my fire service, and I was exposed to smoke, soot, and diesel emissions without the protection of an SCBA when I fought fires, when I participated in a portion of firefighting called overhaul, where firefighters pull apart walls and ceilings. Even to this day, they don't wear the SCBA all the way through overhaul. So if you don't wear the SCBA all the way through overhaul, you're going to breathe in smoke that every study that's involved in these cases says is the most damaging portion of interior firefighting as far as cancer risk goes. That's still happening, and I think that the fact that he doesn't show up with that specific information for PMA, who's been instructed on how this law can be defended, or how a claim can be defended under this law, has led to this problem that we have. Because Mr. Narkin's not alone. He has a very rare cancer, but the treatment of his claim was not very different than many of them before. I've known Dr. Scott for a lot of years doing this work, and I think he's a man of his word. So I do believe they are trying to change it. And I'd even admit that in the last year that I have seen some things change in the way that the claims are handled for my clients, just my clients, that I'm speaking about. But when Mr. Narkin, Chief Narkin, had his claim denied in a day, I have other people who, it might not have been a day, but it might have been 3 days. And, that probably was only because the adjuster at PMA was off for a couple of days, because they were denying these cases right out of hand. They were always forcing the firefighter to come make their proof. And I think that there's just a better, more human way to do this. And I think that there's a dichotomy or a split between the fire department and the way the administration and risk management and PMA handle them. When we the Slatic case is my case, and Scott Slatic and I we're on TV together. It's where I learned to hopefully do lighting a little better today than I did during that interview anyway. But when we were at that interview, they cut a piece of that out that I think was really, really impactful. And that is that the fire department has moved to do things better. The union has pushed to do things better, and the department leadership, they see that no one knows more about the risks that they face than those men and women, and they're doing better. They're doing better with the diesel capture systems, with cleaning gear, with how long they wear the self-contained breathing apparatus. So the department is making and is emphasizing, hey, we have to do better to mitigate our cancer risk. And that's only recently started. But while it's admirable that you've started that now, what about the men and women, men like Mr. Narkin, Chief Narkin, who were exposed for decades before all of that stuff happened? You know, so at this point, we're identifying the problem. We're trying to fix the problem. But when someone shows up with a cancer who worked his way through that other way that was being done, the more risky way that was being done for decades, now we're going to tell him no in 24 hours over a defensible point in litigation. And this is not the spot, and I've had more than one of my firefighter clients blame the lawyers as it would go. You know, that I won't, Miss Murphy can speak for herself. Her job is to defend these cases. When they roll in, if she can find a point to defend, or the lawyers that they hire, once you hire a lawyer to do something, that lawyer's ethically bound to go try to figure out a way to represent you because you're the client, right? Miss Murphy's ethically bound to do that for the city of Philadelphia. So I don't think the problem is someone where we can just point to her and say that they're not doing what they're supposed to do. I think it's more of a policy thing. That's why I was glad that Councilman O brought this up and why I was interested to participate, because I think it's more of a decision for people like you, Chairwoman Bass, and Councilman O, and Councilman Green, who I think asked some very, very insightful questions that I saw too when I came on, to decide how you want this done for city employees. Firefighters and cancer is a good example, but it's part of a bigger issue, that who's deciding these cases. Because if it's PMA, we're going to get a denial on just about every cancer case unless somebody from risk intervenes. And while they have been doing better, they've been doing better mostly with the least expensive cancers. I think they might have had a meeting with PMA to say, basal cell carcinoma, I got a little bit of that being treated here with this. I got some cream in here that's supposed to be taking care of my own little basal cell carcinoma situation. Is not a big deal, right? This is about as bad as it's going to get, what you see on my face, the redness in my face from the cream I'm taking. And I won't need to do anything else for it. So accepting that is not the biggest deal. And that would have been where I would have left it until recently. They did accept an esophageal cancer for a firefighter, which is a different animal, which is, to me, is a significant move, which again leads me back to maybe to believe in Dr. Scott, that they are trying to do things differently. But some oversight from city council and understanding that, you know, once you turn it over to the lawyers with something this technical, you can find some defensible point, something that you're going to point to, even if it's, from my money, as ridiculous as it is in Chief Narkin's case, where you point to the fact that his cancer is so rare that we're going to ignore the fact that it's in a category that's clearly related to group 1 carcinogens, and we're going to say there's, you know, you haven't been able to prove that your specific subtype is related to group 1 carcinogens, because that information just doesn't exist. It doesn't exist for his rare subtype, but it also doesn't exist for many rare subtypes of leukemia and lymphoma, all of which were getting found compensable in the Pennsylvania workers' compensation for these system for these firefighters. And I'm sure I didn't get to hear Chief Narkin testify, but from talking to him in the past, I mean, this is about his family at this point for him, and we are essentially debating the technical aspects of whether the fact that he has this rare subtype, or are you going to look at the category? Because if you look at the category, he cannot lose.
So, well, listen, thank you so much for that wealth of information. Councilman David O has some questions. Councilman?
Thank you very much, Chairwoman. First of all, thank you for scheduling this and working through your hearings to join us again. In this situation, what happens if, unfortunately, Chief Narkin passes away before the resolution of this litigation?
If the chief passes away, then we would file a fatal claim petition to add it to the what's called, for lack of a better term, a lifetime claim petition that's pending, and wait for the judge's result. Again, in my experience, when we've had a situation where we started a case while a firefighter was alive and then that firefighter passed away, the city, through its lawyers and Dr. Scott, have been reasonable with us. If my anticipation is, and Dr. Scott can certainly testify for himself, but if we win this lifetime claim petition 3 days after John Narkin passes away, and I send Dr. Scott the notice of, his death certificate when we get it, and it says that it was related to the cancer, that they will then award fatal benefits. They won't make us fight again, is generally my experience with them, although it would be within their right to do it. And that's also, Councilman, if I may, that's also why I like dealing with Philly people over my Philly clients, because at that stage of it, the man I'm dealing with is Dr. Scott. I'm not dealing with PMA. I think when you outsource something like this, you invite that insurance company subculture into what we do. And in this area, I think it just leads to denial and litigation.
So you mentioned policy and practice, and ultimately, this policy and practice is the responsibility of the administration. I'll just state that council, as a legislative body, we cannot do certain things. We can have this hearing. We can certainly do resolutions, but policy and practice is up to the administration. When the administration outsources to a third-party administrator the direct handling of this matter, where does policy and practice come in terms of who we elected and who that elected person charges with the responsibility of handling cases like this involving Chief Narkin, who is a city employee who's contracted cancer?
At the end of the day, for me, it makes PMA like the Wizard of Oz. It's the person behind the curtain that you get to blame when nobody wants to stand there and say, I am the city official who's denying John Narkin and his family the benefit. Because as much as we sit here, no one's going to stand up and raise their hand to be that person in the administration. And they're going to point to PMA and say, our third-party contractor has decided to deny this, and here's why they denied it. So I think it gives deniability.
To kind of give a different analogy for people listening to this hearing, I mean, we're dealing with COVID-19, and we did pass a bill, and the mayor signed it, providing a protection to healthcare workers who are exposed to treating people with COVID-19, and obviously an example is a nurse who is in the ICU, dealing constantly with the most severe cases of COVID-19, and then when he or she puts in a claim that they have COVID-19, their employer says, well, you could have gotten that on the bus, you could have gotten it at a family reunion. The idea that we now have a presumption that you got it at work could possibly be challenged by a third-party administrator to say, listen, we want to go through the entire possibility that your sister, your brother, your father, your mother, your husband, your wife, that they did not have COVID-19. We want to go through and that could take a very long time, but that does not appear to be what the state law says. The state law says that there is a presumption, meaning that when we don't know, we accept that because you are a firefighter and we want you to serve the public and we want you and your family to be safe and we want people not to consider avoiding the public safety role of being a firefighter, that you have this presumption. You shall not be burdened. You shall not be called to task. We shall accept at a very low threshold the fact that we owe you and your family these benefits.
Nope, I agree, and I think COVID's the next thing we're going to see. I'm representing several Philadelphia police officers who have recently received denials that COVID's work-related from PMA. Even a couple of them who were, among 75 officers at a demonstration that turned up with COVID and had no COVID prior outside of work, in their family. I think that that deniability that we're talking about with cancer for firefighters, I think we're going to see that come into the realm of how COVID's handled for long haul people, long haul COVID people with those symptoms, or even someone who's back to work but they're still coughing. As to your point, there is a difference between acknowledging that someone's out of work for COVID and acknowledging that as an employer we are responsible for COVID as a work injury. And in that space, PMA, like they're doing with these firefighter cancer cases, they're going to enter as an insurance company denying everything and having people be put to their proof. And for city employees, when you're put to your proof, really employees anywhere, but in particular for city employees, once it's no longer considered to be work related, once you're telling them that this is not a work related problem, then they start on a path of exhausting their accrued time, sick time and vacation time. Then they're not city employees anymore. Then they don't have health insurance for them and their family. So there's a lot, there's going to be a lot of weight placed on the city employees who have thus far gotten us through this COVID crisis, in the same way that there's going to be a lot of weight put on firefighters who are going to come through the window of your house to save your kids, and he's not thinking about breathing what he's breathing in or the soot or what his risk is. And the legislature said he gets a presumption, but PMA and in their role in this is denying those claims and making firefighters come fight for that benefit at a way more high percentage than I think the law, having matured the way it's matured now, than it should.
Thank you very much. I'll just make my comment, Chairwoman, and that is I find it, problematic to me that our city comes up with many different ways that people are being held responsible for sickness, illness, and I'm not saying those are bad things. I'm saying that is what the public wants, but the city has a responsibility towards its firefighters, its public safety officers, in compliance with state law and a presumption that I understand. A presumption is a presumption, and that's where we are. I guess the final analysis is that the policy and practice will get a response from the administration. Thank you very much.
Well, thank you very much, Councilman, and thank you very much to our witness. I want to move to our next. I know we have several folks who are waiting to testify, so I'm going to move to them, and then we'll come back to additional questions for our expert witness. If anyone has additional questions, if you can hang around, Mr. Dryden, for a moment.
Will do, ma'am.
Very good, thank you. Can we have the clerk call the next speakers on the witness list?
Queen Judith Robinson, Gerard Welsh, Gary Masiska, and Tony Patterson.
Okay, and if we could start with Queen Judith Robinson.
Excuse me, Madam Chair.
Yes.
We called out to the public comment participants. 2 denied testifying today. They opt out, and the other 2 we could not contact. So as of now, we have no public comment.
Oh, so they're not here. Okay, all right. Well, is there anyone else who would like to make comment who is here? Anyone else who wants to make comment or have questions for our expert witness, or for anyone else on the panel who has spoken before? Any members of council have questions? No? Okay. Councilman O, did you have any additional questions? Oh, Mr. Scott? I see he has some questions.
So, thank you. Thank you. despite what very nicely to me and something that my mother always wished. I am not a doctor. So lots of his points were interesting. That one I can tell you for sure is not accurate, but I appreciate the work and certainly that Mr. Dryden does. Also, just to be clear, with regard to Mr. Dryden made a statement with regard to COVID-19 and PMA, and that's not something that PMA was involved in. I mean, they're involved because they're our third-party administrator, but I just wanted to make that edit as well.
Okay, very good. Thank you very much, Mrs. Scott.
And if I may, just briefly, first, sorry for giving an extra credential there, Mr. Scott, but he's been around long enough that I guess I can still treat him as a doctor. And the second part, I am getting personally PMA denials on COVID cases. So maybe we need to have a dialogue with risk management about that, because we are starting to see them come in, even for officers who've been out for months with COVID, are now getting denials, that are, months after the officer stopped working. So, and they're coming directly from PMA to my clients. So with that's where I get it from. Not that I'm in any way involved in some discussion where they're deciding PMA is doing it. I'm seeing the hard copy of a denial from PMA coming to clients.
Thank you. I see we have Mr. John Narkin's hand is raised. Mr. Narkin?
Yes, ma'am. Thank you. Since it was brought up in the questioning, I just want to point out that and I feel I would be remiss not to, for the brothers and sisters that are fighting the cancer claims, that during the recent COVID epidemic and the current pandemic that we're all in, there have been firefighters that have died from COVID, and their deaths were within hours approved as line of duty deaths because of the presumption. So why aren't cancer claims the same way?
Right.
I just wanted to bring that up.
Well, thank you. And also while you're here, I do want to thank you for sharing your story. I did read in today's paper from Janice, I can't think of her last name right now, but she did an excellent piece on this issue. Say again?
Armstrong, yes.
Yeah, how could I forget that? Janice, if you're listening, please forgive me. But she really did an excellent piece today on this issue, and I just really want to let you know that it allowed the reader to get a full view and understanding of the issue. It really covered, I think, all of the points that you made here today, and I think it gave a level of heightened awareness to the average citizen about what's happening from the people that we expect to run in and save our lives and take care of us and help us. And then, when it comes to helping back, we're not being so helpful all the time. So I think she did a great job on that piece. And, listen, God bless you and your family. So.
Well, I thank you very much. I thank you very much, Councilwoman, for that. And my wife is in the background, and at certain points of this hearing, I had to kind of keep her from running, jumping through the screen. But she is the main reason I'm doing this. And, hopefully that this does some good in both my family and the families of firefighters fighting cancer. We'll be able to get some conclusion before our deaths. That's the whole thing. I would love to die knowing that my family would be taken care of after I'm gone. And that's the whole reason why we're doing this.
It's certainly understandable. It's certainly understandable. So.
And I appreciate everybody for their testimony. Thank you.
Absolutely. Absolutely. Is there any other, are there any other questions, comments? Seeing that there's none, we're going to go ahead and conclude. I see a hand up, but I can't see whose it is. Does someone have a hand up?
That was me. It's just I haven't taken it down yet.
Oh, okay. All right, I see. That being said, with there being no other speakers, and no other questions from members of council, this committee is hereby adjourned. Thank you so much, everyone, for attending and for your patience throughout the day. And this was a really good, informative, and most necessary hearing. So thank you, Councilman O, for your resolution on this issue. And we will be following up and having additional conversations. I certainly will be participating in that, as will all members of the committee. Thank you, everyone.
Thank you, Chair.
Thank you, Chair. Thank you, committee members.